should have stayed were the signs I ignored. Can I help you not to hurt anymore? We saw brilliance when the world was asleep. There are things that we can have but can't keep. If they say, who cares if one more light goes out in the sky of a million stars? It flickers, flickers. Who cares when someone's time runs out? If a moment is all we are, or quicker, quicker. Who cares if one more light goes out? Well, I do. The reminders pull the floor from your feet. In the kitchen, one more chair than you need. Oh, and you're angry, and you should be. It's not fair. Just 'cause you can't see it doesn't mean it isn't there. If they say, who cares if one more light goes out in the sky of a million stars? It flickers, flickers. Who cares when someone's time runs out? If a moment is all we are, or quicker, quicker. Who cares if one more light goes out? Well, I do. Goes out in the sky of a million stars. It flickers, flickers. Who cares when someone's time runs out? If a moment is all we are, or quicker, quicker. Who cares if one more light goes out? Well, I do.
越来越爱你，每个眼神触动我的心，因为你让我看见 forever， 才了解自己。未来这些日子要好好珍惜。爱我有些痛苦，有些不公平。如果真的爱我，不是理所当然的决定，该 感到你的呼吸在我耳边，像微风深情，温柔的安抚我的不安定，所以我要每天研究你的笑容，多么自然。Forever love, forever love， 我只想用我这一辈子去爱你，从今以后，你会是所有幸福的理由。世上最美最远的旅行，沿途遇见你，偶尔阻碍我们的前进，感到你的体温在我怀里，像阳光和煦，巧妙的融化我的不安定，不可思议，Forever love, forever love， 我只想用我这一辈子去爱你，从今以后，你会是所有幸福的理由。你感动的眼睛，我沉默的声音，仿佛就是最好的证明。就让我再说一次 I love you。Have you ever felt like nobody was there? Have you ever felt forgotten in the middle of nowhere? Have you ever felt like you could disappear? Like you could fall and no one would hear? Well, let that lonely feeling wash away. Maybe there's a reason to believe you'll be okay. 'Cause when you don't feel strong enough to stand, you can reach out your hand. And oh, someone will come running, and I know they'll take you home. Even when the dark comes crashing through, when you need a friend to carry you, and when you're broken on the ground, you will be found. So let the sun come streaming in, 'cause you'll reach up and you'll rise again. Lift your head and look around. You will be found. You will be found. You will be found. You will be found. You will be found.
Have you seen this?
Can you hear me? Does this work?
Yep.
Okay, good. So the sound works. The picture is not fantastic, but it will do. Okay lah, so I mute again. Okay. Floor is yours, Dr. Anita. Can you see and hear this?
Kevin and everyone here today with us. And
Yeah,
I was
it's
really
good.
inspired by
Okay, so
our
can see lah.
head of service and her message
Can,
to us
can.
just now.
Okay, good. That
And
one
I hope
works. Does this work?
Okay, now, right, if
Yep.
you want YouTube to see your face, you have to pin yourself.
I have to pin myself. Okay. So I pin myself. Okay.
Now YouTube can see your slide and you.
Now can see YouTube can see my side as me and my
So
can
every time speaker talk,
have to pin
have
lah.
to pin. I
Oh.
think I can pin on behalf, I think lah.
Okay.
Because last time, Boon asked us to pin ourselves.
Okay, can. I'll be here anyway to pinning stuff, so no problem. Okay.
You unpin yourself. Yeah. You want to pin yourself, then you are there.
Okay. Can you hear this?
Can?
Can. Okay lah. So whatever we have, it works lah. Okay.
Just remember to pin yourself. If not, YouTube cannot see the speaker's picture.
Okay, thank you. Worst come to worst, you message me on the other phone lah.
I think I can pin. I think I can pin people.
Okay.
Hi.
Leaky faucet, creaky floor. We don't even own a bathroom door. The sofa set is not have a lot, but there's no shortage here for love. Whoa, whoa, oh, oh. All the pennies in the wishing wells, all the diamonds Tiffany's could sell, all the riches put together, all the sunny California weather could not make me love you any better. You could give me all that I request, and if you fancy, darling, be my guest. But I'll take less if more means having less of you. Who needs sequin shoes or private jets to Kathmandu? Oh, 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 oh. All the pennies in the wishing wells, all the diamonds Tiffany's could sell, all the riches put together, all the sunny California weather could not make me love you any better. I don't need your money, just your kisses and your funny faces, which I miss when you're away. I cry into my pillow, stay up late until you bring me takeout. We make conversation all about all the pennies in the wishing wells, all the diamonds Tiffany's could sell, all the riches put together, all the sunny California weather, all the pennies in the wishing wells, all the diamonds Tiffany's could sell, all the riches put together, all the sunny California weather could not make me love you any better.
Should have stayed, were the signs I ignored. Can I help you not to hurt anymore? We saw brilliance when the world was asleep. There are things that we can have but can't keep. If they say, who cares if one more light goes out in the sky of a million stars? It flickers, flickers. Who cares when someone's time runs out? If a moment is all we are, or quicker, quicker. Who cares if one more light goes out? Well, I do. The reminders pull the floor from your feet. In the kitchen, one more chair than you need. Oh, and you're angry, and you should be. It's not fair. Just 'cause you can't see it doesn't mean it isn't there. If they say, who cares if one more light goes out in the sky of a million stars. It flickers, flickers. Who cares when someone's time runs out? If a moment is all we are, or quicker, quicker. Who cares if one more light goes out? Well, I do. Goes out in the sky of a million stars. It flickers, flickers. Who cares when someone's time runs out? If a moment is all we are, or quicker, quicker. Who cares if one more light goes out? Well, I do. I do.
Unmute je lah. Okay. Hello, hello.
Have you ever felt like
Video, I cannot
nobody
do
was
the video.
there?
Use
Have you
USB
ever
camera.
felt forgotten in the middle of nowhere? Have you ever felt like you could disappear,
Video setting, choose video,
like you could fall
camera, video.
and no one would
No,
hear?
I cannot do anything about this yet. Video setting, USB camera, anything, only one.
Let that lonely feeling wash away.
I just go like advanced.
Maybe there's a
On
reason
my video
to
lah.
believe you'll be okay.
On why?
'Cause when you don't feel strong enough to stand, you can reach out your hand. And oh, someone will come running, and I know they'll take you home. Even when the dark comes crashing through, when you need a friend to carry you, and when you're broken on the ground, you will be found. So let the sun come streaming in, 'cause you'll reach up and you'll rise again.
더는 할 말이 없어. 다른 이유도 어떤 변명도 난 의미 언제부턴지 왜 그런 건지 난 그저 함께한 이 모든 게 힘들었다고 말하잖아. 네 품에 안기던 그날 밤에도 입을 맞추던 그 순간에도 나에게 그 모든 게 더는 너에게 말할 수 없는 상처로 남아. 내겐 그 모든 게 다 부담이 돼. 처음엔 나도 아무렇지 않았어. 깊어지면 질수록 너의 품에서 문득 끝이 나는 게 너무 두려워서 애써 괜찮은 척만
Kevin and everyone here today with us. And I was really inspired by our head of service and her message to us just now. And I hope to continue the momentum for this next, lecture. And I would like to talk about for children with special needs in the theme of our mental health theme for an unequal world today. And I'd like to start my presentation with this quote. The former Prime
Sound works.
Okay.
Okay, screen sharing time. Let's try this. Okay. Sound.
Then,
Screen share works.
yeah.
Okay, good. Stop share. And close this. Screen share again. Oh dear. Screen share again. This one just, Dr. Anita's one working?
Okay.
Yeah, can.
Floor is yours, Dr. Anita.
Dr. Anita one also working? Good. Okay.
You okay then let Nashwa test mic.
Okay, sure. I switch off my video and mic now.
Hello, hello. Can you hear me?
Okay, boleh.
Okay.
Now wait for Dr. Ramli and test lah.
See where he wants to do, whether bilik teleconference 69 or your room or Najwa's room.
Unmute. Hello? Okay. Then.
Yes, boss, can see and hear you well.
Thank you. Boleh. Boleh. Tangan kanan. Stop video.
Oh, kejap just tengok.
Bismillahirrahmanirrahim.
Everyone can start.
Thank you.
All right, I think we can start. Yang berusaha Dr. Nurul Nadia binti Kamarul Nizam, Deputy Director Medical 2 Hospital Tunku Azizah. Yang berusaha Dr. Hajah Salina binti Abdul Aziz, Technical Head of Studies, Psychiatry and Mental Health Services, Ministry of Health Malaysia. Yang berusaha Dr. Haji Ramli bin Muhammad Ali, Head of Psychiatry and Mental Health Department, Hospital Tunku Azizah. Datuk-datuk, datin-datin, specialist, medical doctors, nurses, ladies and gentlemen, Assalamualaikum warahmatullahi wabarakatuh, and a very good morning. Welcome to Mental Health. This webinar is organized by Department of Psychiatry and Mental Health, Hospital Tunku Azizah, in conjunction with World Mental Health Month 2021. The theme for this year is Mental Health in an Unequal World. Mencari timba si anak dara di bawah sarang burung tempua. Salam sembah pembuka bicara. Selamat datang untuk semua. On behalf of organizing committee, I would like to thank and extend a very warm welcome to all of you. We appreciate you taking time off your busy schedule to join us. We hope you will learn a lot today about mental health from our expert panel's presentation. Ladies and gentlemen, for your information, we'll have 4 topics to be presented today, which are mental health in an unequal world, a keynote address by Dr. Hajah Salina Abdul Aziz, followed by unequal support for children with special needs by Dr. Anita Chodati. And then the third topic, the evolution of psychological first aid by Ms. Chan Pekha. And the last one, hashtag Kita Jaga Kita, self-care and psychological first aid for all by Dr. Kevin. All right, to kick off the program, please allow me to welcome Yang Berusaha Dr. Haji Ramli bin Muhammad Ali, our Head of Psychiatric and Mental Health Department, Hospital Tunku Azizah, to deliver his welcoming speech. Doctor, the platform is yours.
Thank you, Nurul. Bismillahirrahmanirrahim. Alhamdulillahirabbil alamin wassalatu wassalamu ala Rasulillah wa ala alihi wa sahbihi wasallam. Terima kasih again Puan Nurul Najwa, pengurusi mas kita pada hari ini. Assalamualaikum warahmatullahi wabarakatuh. Salam sejahtera, salam kesihatan mental sedunia 2021. Alhamdulillah, berkat usaha gigih jawatan kuasa kecil sambutan Hari Kesihatan Mental Sedunia 2021 Jabatan Psychiatry Hospital Tunku Azizah yang diterajui oleh Dr. Kevin dan anggotanya. Pada hari ini kita semua dapat bersama dalam satu majlis untuk meraihkan sambutan Hari Kesihatan Mental Sedunia peringkat Hospital Tunku Azizah Kuala Lumpur. Saya mengambil kesempatan ini untuk mengalu-alukan kehadiran datuk-datuk, datin-datin, tuan-tuan dan puan-puan semua ke majlis sambutan ini dan seterusnya kepada bengkel yang akan dimulakan sebaik saja selesai majlis perasmian sambutan Hari Kesihatan Mental Sedunia sebentar lagi. Saya mengucapkan setinggi-tinggi penghargaan kepada Dr. Nurul Nadia binti Kamarul Nizam, Timbalan Pengarah Perubatan Hospital Tunku Azizah, bagi mewakili pengarah pada pagi ini yang berada jauh di luar pejabat sekarang ni. Dan juga sebagai wakil pengarah dan pengurusan tertinggi Hospital Tunku Azizah yang sudi untuk merasmikan majlis dan bengkel kita pada hari ini. Terima kasih Dr. Nurul. Saya juga sangat berterima kasih kerana kesudian Dr. Hajah Salina Abdul Aziz, pakar perunding kanan dan Ketua Jabatan Psikiatri dan Kesihatan Mental Hospital Kuala Lumpur dan juga Ketua Program Psikiatri Kementerian Kesihatan Malaysia untuk bersama dengan kita pada hari ini, walaupun kita semua maklum tentang ketatnya jadual seharian Dr. Salina dalam menguruskan keperluan perkhidmatan psikiatri seluruh negara. Satu tugas yang berat yang beliau jalankan saban hari. Sambutan Hari Kesihatan Mental Sedunia tahun ini adalah sangat unik keadaannya, di mana kita semua maklum dan terus merasai perbezaan di masa pandemik ini berbanding tahun-tahun sebelum pandemik. Suasana kesihatan, khususnya kesihatan mental, adalah berbeza dan keperluannya juga terasa pertambahannya. Pada hari ini kita akan dapat mendengar dari ketua profesion kita tentang situasi kesihatan mental di negara kita pada masa ini. Saya ingin merakamkan dan ucapan tahniah kepada jawatan kuasa sambutan dan saya sekali lagi berterima kasih kepada tuan-tuan dan puan-puan yang hadir dan semoga panjelis pada hari ini diberkati Allah dan kita semua mendapat manfaat dari majlis dan bangkit hari ini. Amin. Amin ya rabbal alamin. Sekian, wabillahi taufiq wal hidayah. Wassalamualaikum. Terima kasih. Sekian, balik kepada Puan Nurul Najwa. Thank you.
Thank you, Dr. Ramli, for the wonderful remarks. Now, I would like to invite Yang Berusaha Dr. Nurul Nadia binti Kamarul Nizam, Deputy Director Medical 2, Hospital Tunku Azizah, to deliver her opening address. Dr. Nurul, the platform is yours.
Okey, terima kasih Puan Pengurusi Majlis. Bismillahirrahmanirrahim. Yang berbahagia Dr. Hajah Salina binti Abdul Aziz, Ketua Perkhidmatan Psikiatri dan Kesihatan Mental dan juga merupakan Ketua Jabatan Psikiatri dan Kesihatan Mental Hospital Kuala Lumpur. Yang berbahagia Dr. Ramli Muhammad Ali, Ketua Jabatan Psikiatri dan Kesihatan Mental Hospital Kuala Lumpur, Hospital Tunku Azizah. Pakar-pakar, pegawai perubatan dan staf-staf yang terlibat dalam menganjurkan program ini. Tuan-tuan dan puan-puan yang dihormati sekalian, Assalamualaikum warahmatullahi wabarakatuh dan salam sejahtera kepada hadirin sekalian. Terlebih dahulu, saya ingin mengucapkan selamat datang kepada semua peserta kesambutan Hari Kesihatan Mental Sedunia 2021 bertemakan Mental Health in an Unequal World. Saya juga ingin mengucapkan ribuan terima kasih kepada pihak penganjur kerana sudi menjemput saya dan saya mewakili pengarah pada hari ini untuk upacara perasmian sambutan ini. Tuan-tuan dan puan-puan sekalian, Hari Kesihatan Mental Sedunia disambut pada tanggal 10 Oktober setiap tahun. Program ini dimulakan oleh Persekutuan Kesihatan Mental Sedunia atau World Federation for Mental Health pada tahun 1992. Dan ini mempunyai tema yang berlainan setiap tahun seiring dengan kepentingan kesihatan mental semasa. Pada tahun ini temanya adalah menuju kesaksamaan mental health ataupun mental health in unequal world. Tema ini dilihat bertepatan dengan situasi semasa negara kita yang sedang berhadapan dengan pandemik COVID-19. Antara kesan yang boleh dilihat daripada pandemik ini adalah jurang sosioekonomi dalam kalangan rakyat. Terdapat jurang perbezaan yang amat ketara di antara golongan rakyat yang berkemampuan dan kurang berkemampuan dalam pelbagai sisi kehidupan. Sehingga bulan Oktober ini, di Malaysia sahaja bilangan kes COVID-19 adalah melebihi 2 juta kes, manakala kes kematian pula telah melebihi 25,000 kes. Walaupun situasi dilihat sukar dan penghujung kepada krisis ini masih jauh, namun atas usaha gigih Kementerian Kesihatan Malaysia, bilangan rakyat Malaysia dewasa yang telah divaksin penuh sudah melebihi 90%. Ini adalah satu gambaran harapan kepada kita semua bahawa kehidupan kita boleh pulih semula seperti dahulu. Di Hospital Tunku Azizah, semasa lonjakan kes COVID-19 baru-baru ini, kita juga telah membuka beberapa ward untuk kemasukan pesakit-pesakit COVID terutamanya kanak-kanak dan wanita mengandung bagi membantu merawat mereka. Bahkan kita juga telah menangguhkan kes-kes elektif pembedahan bagi memberi ruang kepada perawatan ke atas pesakit-pesakit COVID. Kini sejak penurunan kes-kes COVID di sekitar Lembah Kelang, Hospital Tunku Azizah telah mula kembali beroperasi seperti sedia kala. Namun begitu, dikala bilangan angka-angka kes sedang menunjukkan penurunan, kita masih belum pasti akan kesan jangka panjang pandemik COVID ini sama ada dapat ditangani dengan sebaiknya. Sebagai contoh, di Lembah Kelang, terdapat hampir 60,000 kes bukan COVID yang masih tertangguh berikutan tumpuan perkhidmatan kesihatan kita sedang diberikan kepada menangani kes-kes COVID. Masalah tekanan dan kesihatan mental didapati telah menjejaskan golongan yang kurang berkemampuan pada kadar yang lebih tinggi ketika krisis pandemik melanda negara. Di Malaysia, kes bunuh diri pada tahun 2021 telah meningkat naik 2 kali ganda berbanding tahun 2020. Para hadirin yang dihormati, angka-angka yang dibentangkan ini jelas menunjukkan bahawa kita perlu memberikan tumpuan yang sama rata kepada semua perkhidmatan kesihatan, termasuklah kesihatan mental. Tumpuan juga harus diberikan kepada usaha meluaskan liputan penjagaan atau perkhidmatan supaya meliputi golongan yang kurang berkemampuan. Di Hospital Tunku Azizah, kita telah memulakan program Psychological First Aid atau Mental Health and Psychosocial Support Services untuk kaki tangan di hospital kita. Program ini telah bermula sejak Mac 2020 dan sehingga kini kita berjaya mendapat seramai 215 responden. Selain dari itu, Mercy Malaysia juga telah mengadakan kerjasama dengan Hospital Kuala Lumpur untuk mewujudkan khemah di hadapan Jabatan Kecemasan HKL untuk kegunaan pejuang-pejuang barisan hadapan kita untuk berehat dan melepaskan lelah. Kesihatan mental adalah hak asasi bagi setiap individu. Ini amatlah penting agar rawatan yang disediakan dapat diakses oleh semua lapisan masyarakat tanpa mengira latar belakang. Tuan-tuan dan puan-puan yang dihormati sekalian, setiap rakyat Malaysia haruslah memain peranan dalam membantu diri sendiri dan juga orang lain di sekitar mereka dalam menghadapi krisis ini. Kita telah melihat bagaimana rakyat bersatu padu tampil di hadapan membantu bila mana negara memerlukan sokongan mereka sehingga terbinanya jaringan komuniti yang kukuh. Sebagai contoh, isu kibarkan bendera putih yang berlaku peningkatan ketika berlakunya peningkatan mendadak kes COVID sehingga menyebabkan ada ahli keluarga yang tidak dapat keluar bekerja untuk mencari nafkah buat keluarga. Rakyat bersama-sama tampil membantu dan banyak bank-bank makanan telah diwujudkan di merata tempat untuk membantu golongan yang memerlukan. Dari segi infrastruktur, fasiliti kesihatan primer iaitu klinik-klinik kesihatan merupakan fasiliti terbaik untuk menyeimbangkan ketidaksamaan dalam liputan kesihatan mental. Di Kementerian Kesihatan Malaysia, kita menyediakan perkhidmatan kesihatan mental di 1,001 klinik kesihatan di seluruh negara sebagai langkah rawatan, pengesanan awal dan pencegahan. Antara perkhidmatan yang disediakan termasuklah aktiviti promosi, pengesanan awal dan rawatan. Pengesanan serta rawatan awal adalah amat penting kerana ia boleh membolehkan proses penyembuhan berlaku dengan lebih cepat. Promosi kesihatan mental juga penting untuk menurunkan gejala stigma terhadap stres, penyakit mental, burnout dan juga COVID-19 itu sendiri. Perkhidmatan psikiatrik pula disediakan di 4 buah institusi mental dan 61 hospital kerajaan di seluruh Malaysia. Terdapat juga 25 pusat kesihatan mental masyarakat atau mentari di seluruh negara. Perlu diingatkan bahawa tiada kesihatan tanpa kesihatan mental dan kita tidak selamat sehingga semua rakyat selamat bukan saja pada COVID-19 tetapi juga dari segi fizikal, mental dan kerohanian. Semoga semua usaha ini akan memudahkan kita menghadapi cabaran semasa peningkatan kes kesihatan mental pasca pandemik selepas wabak COVID-19 ini berkurangan. Sebelum saya akhiri, saya ingin mengucapkan syabas dan tahniah kepada jawatan kuasa penganjur sambutan ini. Saya juga ingin mengucapkan terima kasih kepada semua penceramah yang terlibat dalam menjayakan sambutan ini. Selamat Hari Kesihatan Mental Sedunia 2021. Menuju kesaksamaan kesihatan mental di mana sahaja. Ambil kisah, hulurkan bantuan dan rapatkan jurang golongan yang mendapatkan akses untuk perkhidmatan kesihatan mental. Maka dengan lafaz Bismillahirrahmanirrahim, saya dengan ini merasmikan sambutan Hari Kesihatan Mental Sedunia 2021 bagi peringkat Hospital Tunku Azizah. Terima kasih.
Thank you, Dr. Nurul, for the delightful remarks. Okay, now it's a pleasure for me to introduce our first distinguished speaker for a keynote address. So Dr. Hajah Salina Abdul Aziz is a passionate advocate for mental health. Apart from her clinical work as a consultant psychiatrist and head of Department of Psychiatry and Mental Health in HKL, she is also deeply involved in shaping national healthcare policy and currently is a technical head of Service, Psychiatry and Mental Health Services, Ministry of Health, Malaysia. Dr. Hajah Salina's special interest lies in addiction and schizophrenia. She was one of the pioneers in introducing the methadone replacement therapy in Ministry of Health Malaysia. She is actively engaged in research and has produced more than 30 studies under her belt and currently chairs the Medical Research and Ethics Committee. So, without further ado, I would like to invite our distinguished speaker, Dr. Hajah Salina Abdul Aziz, to deliver her keynote address. Dr. Hajah Salina, the screen is yours.
Okay, Bismillahirrahmanirrahim. Thank you very much. Dapat dengar tak?
Boleh, Doktor.
Boleh ya? Okay. Let me get the slide on before we start. Okay, can you all see the slide now?
Yes.
Thank you. Thank you. Susah ni tak nampak audience tau, tak tahu apa yang berlaku. Sama dia tidur ke tidak? Okay. Jangan ketawa. Okay. Bismillahirrahmanirrahim. Assalamualaikum, salam sejahtera. Yang berusaha Dr. Ramli, Ketua Jabatan Psikiatri Hospital Tunku Azizah, all the young specialists, all the MOs and everyone who is on the platform today for this launching of World Mental Health Day. Thank you very much for the invitation and the opportunity to speak a little bit about this on this platform. So we know each year on the 10th of October is our World Mental Health Day. Why we have our World Mental Health Day? Actually, it is to raise awareness about mental health issues. Maksudnya sini kita nak buat-buat bising sikit lah pada World Mental Health Day ni. Kalau tidak senyap je kan. So during the World Mental Health Day ni, everyone will get excited, do a lot of promotion, okay, with regards to mental health and bring out issues with regards to mental health. This year, the World Federation of Mental Health, I think, dia punya theme is mental health in an unequal world. Okay, this theme actually emphasize equality in mental health services regardless of boundaries, and where every individual has a right to good mental health service with regards to accessibility anywhere and anyone. Okay. Tapi ada sedikit kekeliruan, a bit confusion because there is another team. Okay, that this team is by WHO, World Health Organization. Mental health care for all. Let's make it a reality. Okay, if you look at this team, actually, it's almost the same. Talking about the same thing. It's talking about opportunities to people of mental health to get care. Okay, so one team saying it negatively, the other team is positive. I guess you can see that the first team tadi tu unequal world. It is more of a negative connotation, whereas this one you are speaking more on a positive connotation, mental health care for all. Okay, so generally, both team actually tells us to promote and to ensure that all our mental health patients gets opportunity and gets treatment. So every level or every opportunity to everyone who have mental health issues to get treatment. This year, I think during this year, WHO punya assembly in 2021, government around the world actually recognize the need to scale up quality of mental health service because of the COVID pandemic. They think that they need to scale up the pandemic, and a lot of countries was very good in scaling up their mental health service. Okay, but I will talk about Malaysia a little bit later. Okay, let's go to the next slide. Yeah. So when we talk about unequal world ni, apa maksud unequal? Unequal ni adalah situation or situasi where you find it is unfair because it gives more power or privilege to one person or a group of people as compared to another. Yes, we are living in a world that is an unequal place, which means most of the things are not equally distributed, whether it's health, whether it's wealth, okay, whether it's financial, whether it's work, whether it's resources. It is not equally distributed. Okay, so each of us experience different with regards to human rights, opportunities, and quality of life. So we have different experiences. Even if we are in the same country, we have different experiences and opportunities and quality of life. So inequalities, why it happens, it can be linked to many causes. Why you have inequalities, be it this political, be it disaster, be it geographical, ada banyak, a lot of causes why this inequality occurs. Okay. So when we talk about inequalities, unequal world, there are some people in this world, philosophical people lah, yang rasa no, there are certain things that we need to give equal opportunity. Okay, equal opportunity in the sense that we need things like food. People think everyone must have food. Okay, must have food to survive. Everyone must have shelter. Okay, everyone must have the opportunity and the right for good education. Okay, and everyone must have good medical services. At least a standard, okay, standard level of medical care. So WHO is promoting on this. In this, you cannot run away from unequal world, but we try to ensure that certain things, certain opportunities is given to others who are in this unequal world to achieve actually food, shelter, education, and healthcare. Okay, so what about health? Tadi kita cakap pasal health kan, one of the thing that in the world is healthcare. Okay, health inequalities are the unjust and avoidable differences in people's health across the population and between specific population. Okay, across the population and specific population. Maksudnya sini dalam populasi dan juga certain specific population yang mungkin ada sedikit injustice or unjust. Okay, health inequalities are systemic differences in health status of different population group. It means different population group, you find that they have different sort of health status or inequality. And this inequality have a significant social and economic cost, both to the individuals and the society. Okay, if you look at it, ini lebih cakap kepada NCD lah. Kalau NCD, you look across the individuals and society. That's why I think the government came up with B40, T20 and whatnot. Okay, so health inequality therefore involve around differences in 4 areas sebenarnya. Okay, bila cakap health inequality ni belum cakap pasal mental health ya, kita baru cakap pasal health. health inequality evolve around 4 areas. Health status, maksudnya life expectancy. Okay, life expectancy in the sense that people, life expectancy between countries are different. Sometimes between the social status is different, the life expectancy. Why? A lot of social variables that ensure that your life expectancy is different. Okay, access to care. The second one in health inequality is access to care. Okay, the availability, accessibility of care that will somehow increase your health status. That means you have access to care, you have care that you can afford, because we are very lucky. We are in a country where healthcare is given free, actually almost free, although you have to pay $1 to $5, almost free. So our access to care is, the affordability is there. Accessibility with the health center, with the many major and minor hospitals, we are quite accessible to our health. But if we were to compare from to other countries, I think we are one of the best countries with accessibility to health and affordability. Okay, quality and experience of care. Quality experience of care ni, it means that that's why you see a lot of patient wants to go to certain hospital. Okay, a certain hospital, they find that the quality and care is better in certain hospital. Okay, and not everybody get the opportunity to go to this certain hospital that they find that it's good. Okay, for some hospital that you have to pay to go there. How many people wants to go to IGN but they can't? Okay, because not everybody has access to it. Accessibility tak ada. Behavioral risk to health. Okay, for example, smoking. Smoking is more rampant in which sort of countries? Okay, which area? Who smokes? Okay. Other determinant of health like housing. Okay, this one we will go a bit more. Okay, into this. So health inequalities can therefore evolve differently in health status, tadi cakap, access to care, quality and experience of care, and behavioral risk to health. So next, so what about inequality in mental health services? Mental health inequality refers to the differences in quality, access, and healthcare in different communities of population receiving for mental health services. Maksudnya sini, the care for mental health, okay, the care for mental health is different from each area, okay, and it is the social determinants of mental health. Okay? So the health inequality can have, there are a lot of factors that can lead to this risk to mental health. With regards to social determinant of mental health. Example, employment, food, access to care, education, poverty, poor neighborhood, social exclusion, housing. I will talk a little bit more on this. So now we understand that in this unequal world, okay, there are factors that is in the society or community that can lead to inequality of mental health services. Okay. So this picture sort of sums it all to what we are going to talk a little bit more later. So how mental health system and policies, okay, must be in place to ensure that this inequality, okay, of service, mental health service, is balanced. Okay, is balanced. The thing is, you cannot sort of give the best service all the time, but it's balanced. That means you have to give a standard, a standard sort of service where everyone can get. Okay. So if you have mental health system and policy in place that is good, you will then get people or the population who are mentally well. Okay. So let's look at some of the issues when you want to plan policies or system in the health. Okay, one of the things that people talk about is the social gradient in mental health. Kalau you buat master ni, banyaklah cerita pasal social drift, down drift theory kan. Social gradient means that mental health problems are more common further down the social ladder. Ini yang kita buat our ministry did. We did our PERKA B40. Okay. One of the assessment tool in PERKA B40 is mental health. Okay. I just spoke to the designer of the PERKA B40. Not many people are doing the mental health punya module. Okay. And actually not I think they have lots of data there. If anyone interested to look at the assessment they did in PERKA B40 with regards to mental health. Can you have PERKA B40 where people come and do assessment? It includes physical assessment, but there's also a module for psychological assessment, also mental health assessment. So we know from a lot of studies there is an increased risk of mental health problem with lower mental health being. That means the lower you are in the social rank ladder, the likelihood for you to have a mental problem is higher. So being poor can bring about mental health problem. Most commonly anxiety and depression. But mental health problem can also lead people to poverty. Dia terbalik macam saya kata tadi. This is a short note selalu dalam master student lah. Is it poverty causing mental health or mental health causing poverty? Which means mental health problem can also lead people to poverty, because once you have mental health, you are discriminated in employment and you have capacity for you to get work is less. Okay. So sometimes it is also related to being a part of a disadvantaged group. Disadvantaged tu sebab you are mentally ill lah. Okay. Most of working punya question ada, have you ever been treated mentally? So that one will put you in a disadvantaged punya group lah. Okay. Social economic inequalities, that means poverty, okay, lead to mental health problem. So why does it lead to mental health problem? Because when you live in poverty, it is a condition where people are born, where you grow, where you live, and where you work, and where you age. Maksudnya Siti, if you do not change that socio-economic environment, you will grow, live, and work in that socio-economic. You will not come out of it. When you are in that, in that environment, the chances, the risk of you getting a mental health problem is higher. Tadi kita cakap kan. So if you are in the lower you are in the social ladder, the more likelihood you get a mental health problem. Okay. Social inequalities and mental health, okay, they have divided into a few areas lah. One is economy, dari saya cakap tadi kan. Other relational influences, okay, health, disability, and aging. Environment influences. I'll go slowly into each one of these. Okay, economic influences. Kita cakap tadi kan, economy is makes a lot of impact lah on inequality in health and mental health punya services. So living in poverty, debt, income inequality. People in the lowest socio-economic class have the highest risk of mental health problem. This has been found in many studies. Okay, and socially disadvantaged children and adolescents are 2 to 3 times more likely to develop mental health problem. Okay, 2 to 3 times. That means there is an increased risk. That means there is an increased likelihood for them to develop mental health problem. let me remind you, sometimes it is not just the poverty, it's a few factors with the poverty that can lead to this. I think we will go into this later. Employment and unemployment. Okay, important factor in individual fulfillment, bringing autonomy, pride, and confidence. So when you are unemployed, you can become mentally, it can disturb your mental health, especially because actually working, when you work, you have this sense of achievement, you have this sense of, you have confidence. I have seen a few people during this pandemic, they have lost a job and unable to get job, and this sense of failure, this sense of, you cannot control anything, and then the confidence in yourself, like it just gone. Okay, so employment and being unemployed is very, very important factor actually in the society that can affect you punya mental health. Education level, what they find is dropping out of education has been associated with substance misuse, mood disorder, and suicidal ideation. Especially those who can't afford to continue work. When you have a good student, good people who come and becoming frustrated, so they get associated with become depressed, become suicidal, or they can misuse drugs. Okay, the second one is other relational influences. Okay, this one, cultural or social group status, macam migrant, refugee, asylum seeker. I've seen a few people who have done studies on immigrant and refugees lah, with regards to mental health. Hello. Siapa cerita Fimura tu? Okay. And then with regards to stigma and mental health, with regards to stigma ni, macam mana stigma? Stigma is a sense that when you talk about stigma ni, people who are who are being excluded, bila you nak you want to do something, it is because you have this mental illness, you are being stigmatized or excluded. Okay, macam nak kerja, nak belajar, you want to go to university, okay, because you had some symptom of mental illness, you're being excluded. Okay, so adverse childhood experiences, ni very important. Adverse childhood experiences ni, for example, apa? Physical abuse, sexual abuse, emotional abuse. Okay, they find that those children who has adverse childhood experiences, okay, these were indirectly responsible for at least 30% of the mental health problems. Okay, maksudnya children who has experienced adverse childhood experiences, 30% of them were found in the adult punya mental health problems. Okay, adverse experiences in adulthood. Okay, even adult can have adverse experiences. Okay, maksudnya sini things like rape, loss of jobs, serious illness. Serious illness ni sekarang kita tengok banyak yang COVID lah, who had gone through, ventilated, who have, been put on ventilator and survived, that a lot of this has adverse experience in adulthood lah yang kita nampak sekarang. Or those who have a loss during this COVID period and you had no chance of saying goodbye. Okay, so all these experiences can lead to mental health issues. Loneliness, ini our society now, social isolation is an important risk factor for both deteriorating mental health and suicide. Actually, in suicide, this is a big factor, loneliness. Okay, people, we are living in a world where we are connected. Okay, connected, interesting. Like today lah, connected. I'm talking here, but I'm feeling very lonely because I cannot see all of you. I don't know what's your expression. I don't know whether you are sleeping or you are, it's very lonely giving lecture like this. Very lonely. So actually, although we have social connectiveness, okay, connectiveness sekarang ni, tapi the isolation, the loneliness is there. Okay, so this actually not very good in the sense that for our mental health lah. Somebody asked me whether the cognitive the connection that we get through social media the social media is good. Actually, it's not good. Sometimes it can be disadvantage also. Okay. Let me just check the time. Okay, I'm on time. Connection between physical and the third one is health, disability, and aging influences. Okay. Kita tahu kan, most of us know about consultation liaison. How we know that our physical health has a lot of impact on our mental health. Sebab itulah ada special subspecialty panggil consultation liaison. So here we know that the connection between physical and mental health is reciprocal. Okay. Those who have physical health problem are at increased risk of developing mental health problem, while mental health problem increase the risk of physical health problem. There is a reciprocate both ways. Okay, so the more people are disabled or having health issues, it can affect their mental health. Okay, so especially those who have long-term health conditions. Okay. They are 2 or 3 times more likely to experience mental problems, especially things like anxiety, mood disorder. Okay. Ini kita lihat ya, especially those with problem with oncology, renal, problem with respiratory. So this long-term condition can somehow lead to these people to experience mental health problems later. Okay. Okay, the final one, environmental influences. Okay, environmental influences also have effect on how your mental health. Okay, strong evidence shows that environment in which people live, grow, and work can affect their mental health. Okay, tengok grow and work. Work ni pun, that's why you have OSHA. But to ensure that your mental health is well. Okay, live and grow. Ini yang kita tak out of our control. Live and grow ni, things like your housing. Okay, lack of adequate housing. At one time, you have a flat with 1 room or 2 room for a whole family of 7 or 8. Okay. Which is, I think, not a very suitable environment for you to live, especially young children. Okay? It can lead to a lot of things, including the adverse childhood experiences, okay? Or where there is transport option. Okay? Transport option. How many of my young psychiatrists who travel to KL every day, 2-3 hours from Bangi or from Kajang, or far away of Seremban, and yet actually the transport or how they come to work, they communicate to work, some of them has been very stressful. It's been very stressful. Has affected their mental health. I've seen quite a few actually. Okay, neighborhood deprivation. Okay, neighborhood deprivation macam apa? Macam you live in a neighborhood where there's no space for exercise, there's no space for recreation, you're just stuck in this small cubicle, okay, and go to work, okay. So an adversely built environment, okay, environment where you stay, it builds with housing with no flat, staying dekat basement. You see this a lot actually in Mak Saleh punya ni lah. But now kita punya planning a bit better, but the houses are not very cheap. Living in urban environment, okay, sometimes living in urban environment is very, very stressful. Or in adverse natural environment, okay. That's why now we have a lot of advertisement. Kalau tengok sekarang, advertisement on newspaper on good environment and positive environment for your living, kan? Ada lakeside, lakeside house lah, natural environment lah, near forest reserve lah, where but the cost is sky high. Most of us cannot even afford. Okay, or you can even live in a dusun. It is you can get this good environment, but it's not for everyone. So itu yang dikata inequality tu. You have to have this sort of good environment for everyone, so that you ensure that everyone have good mental health. But this good environment is not happening for everyone. Itu yang now they say that although it should be made available to everyone, this good environment. It doesn't have to be lakeside lakeside punya semi-D or bungalow, but at least some thought has been put to have a good environment for the population. Okay, to recap, if we want to do this, economic influences, other racial influences tadi saya cakap, health and disability, environment influences, we cannot do it alone. The psychiatrists, the clinical psychologists cannot do it alone. This is a whole health system when you see that. Okay, so if you want to prevent mental health issues or mental health problems, it is not just us. Okay, it is not just us. It involves a lot of sectors. Okay, it involves a lot of sector where everyone have to play their role. If you were to look here, it involves Kementerian Pembangunan, housing. It involves how you town planning. It involves NCD. Okay, it involves the police. It involves the lawyers. Okay, it involves the financial people. How to plan to ensure people get jobs. How to ensure that give a good education so that people don't get stuck in this economic punya right. So that means when you want to do mental health, prevention, it is not just you. Okay, it is not just you. You need to go out and talk to all these people and convince them. You need to go out and talk to people in the housing, with the police, with the NCD, to ensure that this can be solved. Okay, kita cerita sikit a bit more about this. Is my time still there? Okay. So, bila you cakap you nak improve, this is an example I got from ni. When you want to improve the ni kan, the promotion or prevention of mental health ni. So, bila you cakap pasal reduce economic inequalities. Okay. Ini yang dia cakap reducing class size, yang cakap T40 sikit and whatnot, you have to reduce. There's a lot of things that you can do. Okay, you prevent domestic violence, sexual violence. Okay, what you can do. This is where you come in for the lawyers, for the AG chambers to come up with laws regarding this policy. Okay, you want to stop substance abuse, kurangkan. You have alcohol minimum age, cannot drive when drinking. Okay, so these are things that you do, but it's not you as a psychiatrist, but you as a part of the community. You should speak for this. Why is this important? Okay. See, if you look at this, yang we clinical specialist can ni kat sini saja, sikit saja actually, right down here. Okay. Okay, affordable housing, public space, community participation. Okay. Improve school engagement and emotional. You need Kementerian Pendidikan here. Okay. Trauma informed public services. Okay, psychological therapies for children. So it is a huge thing. Okay, I cannot teach you, or I cannot be talking about too much on this, but you must remember that in doing prevention and promotion of mental health, you cannot do it alone. You need a lot of partners from all ministry. There is a lot of things that you can do to reduce the mental health punya problems. Okay, some of these what you do are indirect effect to your mental health. Okay, as we mentioned this now, dari awal-awal tadi kita cakap pasal inequalities are all around us. Okay, we must have a wide coverage of mental health promotion to reach all levels of society. I think, insyaAllah, Alhamdulillah, for Malaysia, we have a very wide coverage of mental health services. But with regards to promotion, I'm not too sure because not many are coming to us, okay? Adequate screening to identify people at risk. This one, you need to work with the public health people. You need to work with the KK people on doing screening, when to refer and when not to refer. Okay. Good support for treatment. Good support for treatment ni mesti ada a way of, there are some patient who goes to health or KK, they don't want medication, but the doctors there only know how to give medication. They don't know how to do therapy. They don't know how to talk to patients. So you must, centrally, you must support them. How to give good support for treatment, how to help them, okay? Comprehensive aftercare for people who living with mental health. This is with, not with us, not with, it is with Ministry of Kementerian Wanita dan Penduduk and also Kementerian Kebajikan, where where you give supported living for those who are having mental health, chronic mental health problem. Not all sort of mental health, but people like schizophrenia, bipolar, you want to give them supported sort of living condition. Okay, so we want all this, okay, but we have to think of how you want to put this in the society. Okay, so when we think of mental health, we must think of again, that it is not our job, it is everyone's job. Okay, there are 4 ways you can do this so that a whole community approach is taken. One is task relocation. Okay, that means mental health ni bukan hanya pada all the psychiatrists, all the counselor, all the clinical psychologists. It's everyone's job. Everyone need to be involved. Okay. Make every contact count. Ini interesting. Make every contact count. You see, especially those of you who are not lah kata in power, who have meetings with police, with other people in other ministry, make that contact, make that connection, make that networking. Talk about mental health. Okay. Ini selalu Dr. Ann buat. Whenever she talks on TV, whenever she talks on radio, you talk about mental health a little bit. Okay. Have mental health in all policy. Maksudnya, if you look tadi kan, when you talk about housing, when you talk about school, when you talk about work, you tengok, mental health should be in all policies that you make. Okay, whether you talk about housing, rumah macam mana. When you talk about you want to make public space, all that include, you must have a mental health policy. Okay. And very importantly, lastly, is an understanding data. You must collect data. Ini kita tak ada with regards to mental health. Okay, especially crime level, domestic violence, bullying, absenteeism. Okay, so you have to produce data. You have to collect this data. Okay, I don't know who's collecting this data. Actually, public health should do this, and we must sort of correlate this with what's happening in the in the community. Sorry berhenti sekejap minum air. Okay. So, if we are able to do all this, okay, we improve the physical health, we improve the reduction in health damaging behavior lah, macam violence, physical abuse, child abuse and whatnot. Okay, you have greater educational achievement, higher income. Okay, so it will lead to less absenteeism, less crime, improve overall, reduce mortality. In actually, when you do this sort of thing, you will not only affect the mental health, but you affect the whole society. A lot of things happening. Okay, the society become better, not just the mental health. Okay, this is a WHO study yang dia buat about risk of mental health problem lah, exacerbated of mental health inequality during the pandemic actually. I think I will skip this. Okay. So now I'm going to talk a little bit because I have a bit of time. Implication of COVID-19 on mental health services, our services. Okay, how did it affect our services? So when COVID-19 came, I think most of us were unprepared. Okay, it poses a lot of risk lah beyond just the physical health. But the most at that time when it first came, everybody was worried about if they are going to get it. If they get it, are they going to die? You know, so it put a huge strain actually on the people's mental health well-being. Okay, and the mental health stress ni, for those who are in the lower socioeconomic group, it is more. They find that it is more. And also people with existing mental health problem. Okay, you already having existing mental health problem in poverty, and now you have this COVID pandemic coming in. Okay, yang tadi tu. Okay, so this is something from WHO. They find that there is a disruption in the critical mental health service. Okay, 60% reported disruption in mental service for vulnerable people, including children, adolescents, older adults, and women requiring antenatal and postnatal services. Disruption in counseling, psychotherapy. Okay, I'm not going to read all that, but this question came up in Parliament actually. Was mental health services how badly affected during our pandemic? You know, how many clinics were closed? Okay. There were a lot of us who had to close our ward. There were a lot of us had to deploy our staff and reduce our services. Okay, some hospital completely stopped their mental health services, which I find it is very, very unacceptable. How can you stop mental health services when the country is in a pandemic and the mental health services, the admission is not available in the private sector? So I think that is not right at all. Because when we talk about inequality tadi, okay, so actually when the COVID pandemic came, we had a lot of major effect on our inequality tu lah. Tadi economic downturn, job loss, loss of income, isolation, closure of university, closure of school, lack of childcare, you know, and essential worker had to, you know, face a lot of challenges, okay, at that time. So one of the impact yang interestingly yang it came out to me, it came out very worrying was the isolation. Okay, the isolation. People were living in isolation for nearly a year plus. Isolation. You cannot socialize your friend, your family. You cannot go to your father's house. You cannot move. If you can go, you cannot simply hug. You know, you cannot salam. Some of the things that you do can even be punishable through because of that pandemic. So the feeling of isolation is actually very, very, very high actually, isolation. And this isolation, let's say for even healthcare worker, you come to work, but you are isolated because you cannot socialize as before. Makan pun tak boleh makan sama dengan geng. You know, you cannot eat together. You have to eat alone. You cannot sit down and chit chat. If you have meeting, it's online like this. I cannot even see your face. I don't know your expression. There's no connection at all. Okay, so the isolation is very, very, very bad actually during this time. Okay, but we had the social media. Unfortunately, social media might be good, might not be good. Okay, and then adapting to workplace policy lah. Sorry, ini dah ni. So like working from home. Okay, working from home does not sound as good as it is unless you're not really working from home lah. Okay, okay. So it's not easy when you have to manage your own schedule and time, and then there's the blurring of personal and professional time. Maksudnya you are at home trying to work, but your children don't understand that you are working. You know, your children don't understand. They start screaming. They want this and want that, and they want you to be So that blurring of line makes it very difficult to do work from home, and a lot of distraction. Okay. There's no reduced supervision and direction, communication and coordination challenges. I mean, you not coordinate your discussion and your communication. Like today, you want to do the workshop, you must make sure that it's done well, you coordinate well. It's a lot of challenge actually. Okay. Unclear performance metric, you stay home, you don't know what you must do, how much you must do. Okay. And again, it comes the social isolation. And this one is the worst of all, I think, especially mother with children online classes. Online classes is a lot of stress, okay? Causes a lot of stress. Gadget shortage, crashing system, and then distraction everywhere, okay? Distraction, okay? Staying motivated online, yes, staying motivated online. Technical issues, connectivity, always lying down, okay? Diminished social aspect, okay, and some students being left behind because they don't have this. And on top of this, I think I should add there WhatsApp to mothers. If you have 4 children, you have 4 WhatsApp from teachers to you regarding your PDPR, and it is a havoc and a very stressful time. Actually, some mothers will celebrate the opening of school. Okay, and then we find that the population mental health during this time, because all the issue, ada banyak lagi issue, but I'm not going to talk too much. The population mental health, the mental health of the general population become worse. Okay, why? We see a lot more child abuse. Okay, ini tadi Timana Pengarah mentioned to you, child abuse, domestic violence, suicide, all has increased during this pandemic. So that is a reflection that our mental health the population mental health has somehow become worse, okay, during this pandemic. And on top of that, our essential workers, okay, who are being asked to work, okay, but isolated, okay, they have also and also they are at the increased risk of contracting the coronavirus. Okay, you have at the increased risk of contracting coronavirus, you are also at risk of bringing it to other people that you love at home. So this sort of scenario has been very stressful to our essential workers. Okay, how did we adapt to these new norms? How did our mental health adapt to this? Okay. So one of the things that this is a slide from actually WHO lah, safeguarding the mental health service. You mesti safeguard the mental health service, okay, to ensure that the population punya mental health ni tadi kan saya sebut population mental health ni reflection of your access to service ni. Kalau access to service is not there, itu yang dekat parlimen dia tanya baru ni, anybody close and what not. Why? Because once you have people anxiety, depression, people start domestic violence, start being angry with each other, they find that these people are not being served because you all have closed your hospital. Itu yang a lot to answer to. So WHO suggested that you must safeguard your access to mental health services. Okay, access to existing mental health services should be assured. Which one, a lot of you close your services, so that's why there was a bit worrying. Access to existing mental health services should be assured. That's the first thing WHO cakap. You must ensure that access to mental health services is there. You cannot close it. Okay. Mental health services quickly shift to a new mode of delivery. We now, okay, kalau you want to ensure that access is there, you now have to shift to a new mode. Mungkin tak, because now people cannot move. People cannot move from their house. But how can you do it to ensure that there is existing mental health service? I will talk a bit more about that. Mental health services should move significantly to non-face-to-face format. Okay, a new form of mental health support. Mental health support. Maksudnya sini, dulu you have counselling and whatnot. How do you do it now? You have the mental health support should now be information material should be mostly online. Okay, adalah pamphlet yang you bagi sana sini. People actually what we suggested is kalau you buka Mas Jastra, are you stressed? You can always, it should be linked to that. Okay, with information materials. Okay, mostly online. New mental health support phone line. Some of you did great in this. You had lots of phone line that you had where people can call up. Okay, shift mental health services to telemedicine format, in some cases, increase service capacity and entitlement. And in some countries, increase investment in mental health. So we did. We had quite some of money from ministry for this investment. We had computers, we had some of you had computers, some of you had telephone line, I think. Okay. So how do we shift to a new mode of delivery from face-to-face to phone consultation and also to telemedicine? Okay, this is done with a lot of places, but unfortunately Malaysia ni, kita punya a lot of our device, a lot of our things that we use are so outdated. When we had this pandemic, komputer kita pun dah lama, ada yang dah orang kata apa dah tak sesuai untuk this. So we were caught lah in this, for new computers, which have, video conferencing technology and whatnot. Okay, so we can shift, but at that time, there was a lot of logistic issue. Okay, so this one you must think about it. Okay, oh tak ada, hilang dia punya tu. Okay, ini is we also change to our new mode where we have services from the pharmacy. Patient bila tengok online, phone punya consultation, how do you send medication? Inilah drive through, some of them is through post laju, okay, some of them through pick up, these are some of the innovation they had. Some of this has stopped, but I think we must think back whether we should continue these services. Then you have the, macam setakat tadi lah, new access to promotional materials. Okay, so a lot of you have done well in this. You have made posters, you have made short promotional material online for our patient. And we had also increased our phone line help mental support. Okay, as I mentioned to you just now, dari awal lagi, we cannot do it alone. We We need a lot of people support. Okay, so when we did this, people from Mercy, people from Kementerian Wanita, with their talian kasih, so a lot of people came in. A lot of them work with us. Okay, remember, we cannot work alone. We need other people to work with us. Okay, to make this, to achieve this. Okay, I think I stop here. I've spoken quite a lot. I hope that you all have take in the message. I think the most important message here is that mental health problems, okay, can be due to in an unequal world. Okay, but we have a lot of opportunities to improve this to ensure that the population gets a good mental health, and do not be afraid to change. Okay, thank you very much. Assalamualaikum.
Waalaikumsalam. Thank you, Dr. Hajah Salina. An interesting keynote address in explaining what mental health in an unequal world is. Hopefully, all of us have a better understanding about it. So I think we can proceed to our second speaker. Okay, ladies and gentlemen, our speaker, Dr. Anita, unfortunately is not here with us due to personal reason. However, we have her video recording and we'll play the video for you. But before that, let me introduce her. Dr. Anita is a distinguished child and adolescent psychiatrist serving in Hospital Tunku Azizah. She graduated with an MBBS from IMU and attained her Masters of Psychological Medicine at University Malaya. She has done her service to the nation by being the head of Department of Psychiatry and Mental Health at Hospital Keningau, Sabah, before joining Hospital Sungai Petani. These experiences awakened her passion in child and adolescent psychiatry, and she has done her subspecialty in Hospital Kuala Lumpur and Hospital Tunku Azizah. She has an eclectic range of interests in the field of psychological medicine, having treated numerous cases of anorexia nervosa, and has undergone training with family therapy, schema therapy, hypnotherapy, drama intervention therapy, and she is the only one person in Malaysia trained to administer MIGDAS, and autism assessment tools. Without further ado, we would like to play Dr. Anita's video for her topic, Unequal Support for Children with Special Needs During the COVID-19, with the subtopic, The Playing Field is Not Level.
Kevin and everyone here today with us. And I was really inspired by our head of service and her message to us just now. And I hope to continue the momentum for this next lecture. And I would like to talk about for children with special needs in the theme of our mental health theme for an unequal world today. And I'd like to start my presentation with this quote. The former Prime Minister of Great Britain, Tony Blair, she said, if every child matters, every child has the right to a good start in life. If every child matters, every child has the right to be included. And that is so important. And I really take to heart what she says. So when we talk about an unequal world, what are we talking about really? The myopic economic interests of countries? That is definite, and it has clearly taken precedence over global environmental concern, especially like climate inequality in the past century, actually. And if we talk about the world's wealth, we know that the top 1% controls about almost 50% of the world's health. And in this cartoon, percent still feels it's not enough. But if you look at the other side of the world, there are so many issues plaguing and making life just so challenging for the children of today, creating this issue of inequality. And if we look, and this is from a report in 2016, human deprivation lingers and it actually hampers well-being. In terms of poverty and hunger, it actually causes so much of issues, stunted and underweight. And if you look at issues of health, mortality, and also education, you would find that there are so many people and children who have not had access to education. And if you look at basic social services and access, there are millions and even billions of people who have issues even having proper sanitization or proper sanitation facilities. And this is a huge concern to everybody. And again, people are very, very engaged in talking about being a global citizen. And what you would find is that this only applies to the upper class, where most of them feel like they have access to all the of our global community. You would find that they do not agree and they do not feel engaged by the concept of global citizenship. This creates even a greater disparity and therefore inequality again. And so when you talk about barriers to equality, there are so many barriers and it can be broken. So narrow self-identity, this is to do with nationalism, and there is this 1% of the population that controls the global wealth. Intolerance and exclusion, that is such an important issue today because there are so many discriminations there are social norms that are not really unified. There's so much of violence. And there's weak bargaining power for those who are underprivileged, thus creating even more inequality and the lack of voice. And so let's talk a little bit about the concept of privilege. Other side of the coin of inequality, isn't it? So on the top of the coin, you have advantages other people don't have. Maybe you didn't earn it, you just happen to be born into it. Something of the example of being handed a silver spoon. And you have it because you happen to be this person that you were. And there are so many issues in the social structure that produces and maintains this inequality. Then the bottom of the coin is just completely the opposite. And if we look at it further, of course, this was taken. So it was talking about the white privilege, but this can be applied to any part of the world where the dominant sort of, culture or people would be equality to the white privileged people. Longer period of time, the settlers. And on the other side, you have all the other people who are the minorities, so to speak, and they kind of make up the underprivileged or people who are at greater risk to inequalities. And I'd like to show you that would explain in a sort of graphic form the concept of inequality and what we don't realize exists in our community today.
Some people are born into families where they have to walk miles just to get water. All I have to do is turn on a faucet. That's privilege. If you have ever tried to change your speech, if you were embarrassed about your clothes or health, if you could never think twice about calling the police or trouble.
I think privilege is when some people have some things and other people don't have things.
I feel privilege is something that you don't even really have control over. I think it'd be silly for me to say I don't have a fair amount of privilege, considering like the country I live in and the job I get to do and the college I was allowed to go to.
I suppose being a white male will help me end up somewhere towards the front, but I'll take a few steps back from being gay.
I don't think I'll make it to the front. I think I'll maybe be in.
If your parents work nights and weekends to support your family, take one step back. If you can show affection for your romantic partner in public without fear of ridicule or violence, take one step forward. If you were embarrassed about your clothes or house while growing up, take one step back. If you have ever been diagnosed as having a physical or mental illness, if you've ever been bullied or made fun of based on something you can't change, take one step back. If you get time off for your religious holidays, take one step forward. If you came from a supportive family environment, if you can see a doctor whenever you feel the need, if you are able to move through the world without fear of sexual assault, if you took out loans for your education, if there were more than 50 books in your house growing up. Positions.
I think it felt kind of strange for everyone.
It's a hard thing to discuss or even reflect on. It was very awkward. I think when you it definitely takes on a new form.
I think we were like all joking around in the beginning. I was pretty lighthearted, and as soon as the questions started coming in, the mood shifted immediately, and we all it was just silent.
Just looking back and seeing like a bunch of people behind you is not a good feeling.
It's like weird how you want to like hold on to explaining a certain privilege, like, oh, but it's weird to like take a step forward when you feel like you're taking a step forward with someone else, but you wear a lot of the baggage of like how those things were hard. It was like more emotional than I thought it would be.
It reminded me of when they talk about slavery in high school and you feel like angry for a few days, but then you just realize like
For me, it was kind of frustrating almost to look back and see how much further some people were behind me, and realizing that, you know, a lot of that stuff, no amount of hard work or even legislation can make up that gap. It's interesting being an Asian American because you're not really sure where you fall on.
One of the reasons I ended up so far back was that there are questions around safety as an African American, as a woman, as a gay woman. There are just so many different ways that I don't feel safe.
I feel like I just learned to be grateful for what you have. You know, we're in such a huge society where it's always complaining about what you don't have.
It just shows you that for some grandparents did good, my parents did good, and I'll do even better.
I do think if you're not like aware of privilege, you should do this exercise, but it's more complicated.
And so let's talk now about children with special needs after looking at what inequality is. Children with special needs have various difficulties, including physical, emotional, behavioral, or even learning disability or impairment. And this causes a child to require additional or specialized services or accommodations, such as in areas of education or recreation. This is a very broad concept, but what I want to bring to your attention is that children with special needs are just more than children, you know, who need a wheelchair or who has Down syndrome or who has autism. Children with autism is an area of interest of mine, but I think we need to think in a global perspective or even in a Malaysian perspective, what special needs could constitute. And so let's look at the urgency and the evidence of the crisis. What we know is that around the world, mental disorders are obviously thought. Diagnosable mental health conditions affect 1 in 7, and that is a large number. And a fifth of adolescents, that's almost 20%, have a mental health condition. Suicide tragically claims lives every year, and 1 person in every 40 among young people. And this is the most important piece of information. Almost half of all mental health conditions start by the age of 14 years. And most cases, while treatable, go undetected and unmanaged. More so in children with special needs. And the pandemic, COVID-19, illuminates the urgency of a global population-wide approach to child and adolescent mental health, especially those with special needs. 3 key ideas that have been spoken about by experts around the world to talk about how we want to look at the evidence, and we know that the evidence is overwhelming, especially for early risk of lifelong poor mental health. And we think about how societal costs of inaction in childhood are life-lasting and substantial. What we know, though, is now we are more time in history to reduce these risk factors in children and adolescents. So what is it that children need to thrive? Children only thrive when they feel safe and protected. And sadly, in an unequal world, especially with children with special needs, more so, they do not get these. Family and community connections are stable. They thrive very well. Unfortunately, this is not the case in an unequal world and children with special needs. And their basic needs are met. Basic needs such as mental health needs, water, poverty, adverse childhood experiences, and humanitarian crises are serious threats to this primary attachment. And this leads to the concept of something we call transgenerational trauma, where the impact is felt over generation. So just to explain a little bit about transgenerational trauma, or the grandparents have gone through hardships and their emotional needs were not fully met, as well as perhaps some of their basic needs, and their needs to feel safe and safety and protection. And so this is then passed on to their children, where it starts to show in and a dense work of relationships in the community, in the family and school provides as a second buffer, because we have to understand that sometimes it is not possible for everyone to, have families that are stable. So this secondary attachment is very important for children. Primary caregiver is absent or inconsistent. And we need to advocate this, especially for children with special needs. I would like to play this video. And this is actually a short clip of the full documentary by a physician. He explains the concept of what I was talking about just now, transgenerational trauma, and how it impacts people of today.
In the US, the richest society in history, fully half of the citizens have a chronic disorder such as high blood pressure or diabetes. Anxiety amongst young people is growing rapidly. Rise as are addictions. Depression is rising. Youth suicide is rising. All is not well.
I started heroin at 26. That's what really destroyed me. It just takes the pain away.
It's easy to want to escape reality completely instead of coping with it.
Can we be human beings in the midst of civilization? Because what we call civilization demands the denial of human needs.
Please welcome Dr. Gabor.
Every human being is a true, genuine, authentic self. And the trauma is that disconnection from it, and the healing is the reconnection with it. Why do we get disconnected? Because it's too painful to be ourselves.
So you sort of a bit like in the Matrix when Neo sees everything's made out of numbers. You look at people and you see all their trauma and damage.
That's what I see. So trauma is not the bad things that happen to you, but what happens inside you as a result of what happens to you.
Shame.
Thank you.
My father, he was fantastic to take a belt to us.
Who did you speak to about your pain?
Nobody.
Yeah, that's the trauma. In other words, by the time you're 5 years old, you're completely alone. People are much more lonely and isolated than they used to be. Presses the immune system. You've been diagnosed with prostate cancer. Correct. In my view, people that develop cancer have a hard time expressing healthy anger.
Hillary Clinton versus Donald Trump, there were two traumatized people fighting to govern a traumatized world.
That's exactly what I'm saying. And these are the people that power. Our schools are full of kids with learning difficulties, mental health issues that are trauma-based. But the average teacher never gets a single lecture on trauma. We need trauma-informed medical care, trauma-informed education. If we had a trauma compassion.
You did. You made a difference in my life.
Thank you for being in touch.
I don't feel like I'm a bad person anymore. Hey, how are you?
Yeah, I just want people to see the truth. Solutions are they're not afraid of the truth.
I think the biggest thing that this whole healing journey has taught me is how to be healing.
So that was a very impactful documentary when I first watched it. And this is something that I always talk about when I am, with my trainees about parenting license. It may sound like a joke, but if we could agree on a low-cost, evidence-based, essential package of parenting support, we could potentially disrupt the intergenerational transmission of adversity Mate talked about, which is a trauma-informed approach or care, and equip parents to protect children impacted deeply by poverty, humanitarian crises, and other severely distressing events or experiences. It is not the bad things that happen to you, it and the lack of response of people around you that actually causes the issue. And so such a package should include skills, problem solving, self-awareness delivered with primary caregivers and infants starting during pregnancy and with a particular focus on early years, as we know with the early childhood adverse events just during the development cycle, including adolescence. And this could be reinforced by intentional policy of building kindergarten, school, and community commitments to ensure that all children are seen, soothed, and safe, and have conditions of connection and belonging. And what is our government's role? Well, governments should prioritize investment in mental health for children and provide tailored services to support varying and often complex needs. This means investing in competent mental health and psychosocial support workforce, because often who claim to have mental health expertise, but competency isn't, often assessed. And we want this to happen across health, most importantly, education. Like Gabo Mate says, we need teachers who have trauma-informed care knowledge and a whole society approach to mental health prevention, promotion, and treatment. For example, we only have one child psychiatrist per million of our population. Yet we know that mental health makes up, 1/3 of the non-fatal global disease burden. That in early childhood, especially when it comes to mental health issues. We need practical programs that provides assistance, that prioritizes mental health, and this would break cycles of conflict, instability that hinders progress in families in Malaysia. And I would like to also urge us to consider insurance coverage, which we do not have, and it's terribly lacking in our country today. And those with special needs especially, because they are at high risk and they're a neglected group, as our public health system has been having great difficulty in recent years coping with the rising cost of treatment and the rising cost of expertise in recent example. I was basically self-trained, and I had to spend my own sort of funds to get myself trained to do certain assessments, such as the MIGDAS assessment for autism and the ADOS assessment for autism. And therefore, and one of the privilege that we had, because back in 2018, I believe, I received a scholarship to attend a program in Rome, and a group from Harvard came over to sort of childhood events, and they conveyed the whole information through this brain architecture game. And what you see here is a program that we conducted with a group of primary healthcare workers, including staff nurses, sisters, supposed to depict how fragile a child's brain can be, and that unattended or lack of response to early adverse childhood events can cause damage. So it was a very, very interesting workshop for them. And other stakeholders, yes, we know increased expenditure is essential, but it's not enough. We need increased conversation, trust, and understanding of mental health, real action as well. And particularly in our country, where we have limited public conversations about mental health. But I must say, I'm proud that, in Malaysia, past 10 years, but I think we have a long road ahead. We have a need for global and community level conversations that take away the shame, judgment, and stigma, which hinders us from speaking freely about mental health issues and promote understanding and knowledge, because this would narrow the inequality gap, take action to promote child and adolescent protective factors, focusing on effective family and community-based solutions. And this is also where I believe the role of media, especially social media, can be utilized further in a way to promote healthy discussions on mental health matters. And I think this is actively happening today. The integration of mental health in school curriculum is very important, and we need to develop training guide for teachers, especially those who are taking care of social needs. And I would like to also address that we need teachers who are able to focus on different social special need children, because at the moment, need teachers, one teacher has to focus on different children with different special needs, which is actually an impossible task. And we also need to have a training guide for social workers to address these mental health issues. The COVID-19 pandemic has underscored how critical mental health issues for special need children. And the magnitude of the mental health burden the world faces today is simply not being matched by the response it demands. Many families have struggled through the pandemic, especially families with special needs, to provide their children with internet, devices, other essentials to support learning when school have been. Educators as well need to be more knowledgeable and trained in addressing various often ignored special needs of undocumented children in our country, refugees, minorities, orang asli children, LGBTQ, divorced families, and so on, which is terribly lacking, but shows great promise in the future ahead. The world we want would be people that are no longer in poverty and hunger, and we could ensure their dignity and equality. We would like to have global prosperity and harmony with nature. We would like to foster peace, just and inclusive societies. In a global stage, we would also like to protect our planet's resources and for future generations. And so we would like to try and achieve this by committing, connecting, and communicating, because we need to commit to focusing on children with special needs. If we do not make this commitment to invest and to take holistic steps, we might not achieve our goal. And we have to promote connection by parenting programs that are responsive, nurturing, and supporting parents and caregivers' mental health. Too, children with special needs may have parents who are burnt out and who need even more mental health support than parents of children who are just typical. And we would like to ensure schools can support mental health needs and quality service. And this includes creating harmony among students and reducing the issues of bullying and so forth. We would like to communicate well by taking leading role in breaking the silence surrounding mental health, addressing stigmas, promoting mental health literacy, and engaging children and young people. I think this is a way to move forward and to look at things. Often it's always a top-down approach. People like me and others who are in very, very responsible positions often are given the task, but we do not go down to the ground level enough to ask children what. And I think this is very important. Just like in some of Malala's talks, if we've listened to some of her wisdom, we need to ask children of today what they need for tomorrow. So there is this concept of what we call neurodiversity and neuro popularized by Peter Vermeulen. He's a prominent researcher from Belgium in the field of autism, and I had a great privilege of meeting him. And so back in the year of 2016, 17, 18, and even 19, we were very much into the concept of, who have different diversity in terms of their thinking and behavior, special needs, to be included rather than to be excluded. And we have seen that even in our special needs education, we have inclusive classrooms. So that is a step in a positive direction. And Peter, he wrote a book, I Am Special, was a very good book about how children with autism can look at integrating themselves into society and norms. And this was back in a conference in Singapore. 2021, Peter has come up with the concept of neuroharmony. And I'd like to share this video featuring Peter talking about what he means by that.
There's this new term neurodiversity, which in one way I like because it stresses the fact that we are all unique, that we all have different brains. What I don't like is that we start making groups of people and saying the autistic, the non-autistic, the neurotypical, the autistic. I think there's only one label that is important to me, and that's our first names, our name. And then we have all different labels. So I like to think of neuroharmony as a world wherein diagnostic labels are less important than all the other labels you have. There's just one of the many labels you have. Rather than hyper-focusing on the diagnosis. I don't like the distinction, neurotypicals versus neurodivergent people. We're all neurodivergent because who has a typical brain? I don't think there's somebody who is neurotypical. Let's take every unique person as a unique person, and then this is their idea of neuroharmony. Every single note is different, is sounding different. Where is your place in the music piece? And finding that particular place, that particular spot is important. And of course, the diagnosis is one of the many, but not the only one. So therefore, I hate things like, what are good jobs for autistic people? I think that's a silly question. Or that everybody with autism should be in the IT world. No, I know people with autism who love being out in nature. Okay, let's find your unique place. Nature that other people value.
And so you cannot drink from an empty cup, can you? So what are you going to do about it? And I'd like to pose this question to everyone who's listening to me today. How will you bring equality? Currently not very equal. Thank you so much for listening to my short lecture. And I would like to thank the team behind me, where I feel truly equality is experienced in all that we do. Thank you very much.
Thank you very much, Dr. Anita. We will be stopping the recording now.
All right, thank you, Dr. Kevin. Thank you, Dr. Anita, for the video recording and for the wonderful presentation. Okay, ladies and gentlemen, now we can proceed to our third speaker. We have Miss Chan Pek Ha here. She is a clinical psychologist, graduated from Masters in Clinical Psychology from University Kebangsaan Malaysia. She began her work in private practices, mainly managing cases of children with special needs and adults with mental health disturbances. She was a sessional psychologist in Pediatric Institution Hospital, Kuala Lumpur, and later joined the Department of Psychiatry and Mental Health as a government officer in 2012. Besides from conducting psychological assessment and psychotherapy, she also supervising clinical psychology trainees, organizing mental health events, providing talks and training in various workshops, including disaster management. So without further ado, I would like to invite Ms. Chan Pek Ha to deliver her talk on the evolution of psychological first aid during the COVID-19 pandemic. Ms. Chan Pek Ha, the screen is yours.
Video.
Okay, can you all listen to me?
Yes.
All right,
Yes.
can see the slide as well?
Yes.
All right. Is this better?
Yes, better.
All right, okay. So good morning to all of you. Okay, cannot see your face at here. I only see my screen. Okay, so I'm Becca, clinical psychologist. Okay, so thank you for the invitations for today's events. Okay. Yep, okay, I was given a topic about this, the evaluations of psychological first aid. Okay. It's actually quite a challenging topic for me, okay, as in like PFA is already quite common, okay, especially after the pandemic, okay, I mean during the pandemic itself, okay. So talking about evolution as in like in what way we can improve, okay. So that's really made me think a lot, okay. So not so much about introduction about PFA, but I think before moving to the way forward, okay, I think probably we just talk about like the chronological about how PFA become popular. Okay, so definition, approach to assist individual in the immediate aftermath, okay, of disaster and terrorism. Okay, so this is what PFA used to be. Okay, and the objective as well, of course, is to promote for safety, ensure basic needs, stabilize emotion, connect individual together again. Okay, so one very important thing that here, do not harm. Okay, so the reason for me to mention about this, because I would like to bring you all to the another concept at here. Maybe some of you are quite familiar with this also, which is CISD. Okay, so it's somehow like a comparison at here. So before PFA become popular, people are actually using CISD or debriefing, okay, to help with individual who have individual with disaster concerns. Okay, so what is the main difference is like before this, okay, which is I think it's like before 1922, if I'm not mistaken. So debriefing was widely used, okay, as a one-off sessions for survivors. Okay, and at that time, mostly debriefing are talking about facts, okay, talking about your experience with the trauma itself, okay, talking about coping skills. So it's more on a little bit on the intervention base, okay, and mostly run by mental health professionals at the time. Okay, so after that, there are research talking about will debriefing or CISD create secondary trauma to survivors. Okay, and that's how people started to use why not we use a PFA concept, which is not so much talking about the facts itself, not so much talking about the direct experience of the trauma itself, okay, but we focus on the promoting safety, talking about basic needs, okay. We talk about emotion as well, but maybe not emotion so directly related to the trauma itself, but more about emotions about how people feeling at that particular moment, okay. And most importantly at here, which is the connection, okay, which is link, okay, how well we can connect people together for faster recovery, okay. And the benefit about PFA compared to CISD, okay, will be it's not only for one-off sessions, but it also can be a follow-up sessions whenever it's needed. Okay. So these are some of the differences that here. which is CISD itself, talking about introduction as usual, PFA as well. We do introduce ourselves and the purpose of the session itself. So after that, CISD talk about facts, like thoughts related to the experience, your reactions, talking about some symptoms that develop, okay? And also after that, only we talk about coping, okay? And re-entry again about the situations, how well we can actually interpret and perceive about that in a different way, okay? And CISD usually happen 3 days after the particular events, okay? But PFA, when you look at these 8 core principles, okay, is somehow more comfortable, okay? We don't really talk about the trauma itself, okay, as I mentioned just now. So more on the safety, how to stabilize people. We talk about information sharing, information gathering, okay? A very practical assistance at here. If you need medication, we provide, okay? If you need relaxation technique, we provide, okay? If you need food, we provide, okay? So that somehow PFA in a better, like more down to earth, okay, easier for people to accept as well. So because PFA system, they are more common, okay, and easier to deal with. So that's why not necessarily have to conduct by the mental health professionals. Any trained personnel in PFA actually can become a PFA providers. And this trained personnel doesn't mean that have to go through like a certificate course or something, but more or less it's like you at least go through like a understanding about PFA, certain skills training, like maybe a 2 days workshop, that will be quite sufficient for you to be a provider, okay? All right, this is some of the evaluations about PFA, okay? So as I mentioned just now, okay, so it's by this program, okay, social program by SAPS, okay, by the War Office of United States in 1922, okay? They provided this program with 5 focus, which is safe, calm, empower, connected to loved ones, and instill with hope. If you look at this, it's actually quite similar to what the concept that we are using currently, okay? So after that, these researchers, they propose a manuscript to American Psychiatric Associations, okay, as a guidelines to help with aftermath of this community disaster, okay? And with that, they implemented PFA on adult with in disaster, okay, in 1970, and children following by that in 1988, okay? So after that, only some emergency organizations are using that, which is, for example, like the Red Cross associations, okay, and some other association at US who are started to share about PFA with their survivors, okay? And the first outline of this PFA concept is actually in 2007, which is also focused at a similar concept. Okay, so the reason for me to keep mentioning about that is because I just want to share my own experience with all of you, as in like PFA is something accessible and available for anyone who would like to practice on that and would like to provide on that. Okay. Okay, talking about the way forward. Okay, so yep, I'm highlight at the side of it. So which is like probably I'll talk about something about promotions, educations, training, of course. Okay, and also possibly some research and collaborations in different organizations or parties. Okay. But before I proceed with the discussions, okay, so I would like to share my experience when I was attended 2 weeks program in Japan, okay, Kansai, Kobe, Japan, okay, for these PFA courses in 2018. So this is a 2-week learning trip with site visits, okay, so compared to some training I received at here, which is a very hands-on experience. We expose to various disaster-related topics, okay, which is including communications, including different disaster, as in like transportation disaster, air disaster. Okay, so they are the Japan experts are sharing how they the system of them in managing all these disaster on their own. Okay, so I put down the keywords at here because this is something I found it very, very interesting, okay, and also amazed me a lot, which is the community training, okay. So in Malaysia, I think at the current moment, we are still focusing PFA as in like by people with background, for example, with mental health background, let's say the maybe psychologists, counselors, doctors, okay. So, and but over there, they are actually doing it at a community base, which is any citizens, they are accessible to PFA knowledge, okay. And also they are putting it into a syllabus in a school, okay, since a primary school. So I think it's not something we are not familiar with, which is like, yeah, they have this, you know, like that prone to disaster conditions, okay, whether it's a volcano, you know, like even a tsunami and things like that. So the students that they do have drills, okay, talking about like the simulation and things, what they're supposed to do in the school syllabus itself. Okay, accessible information, yes. Okay, the information is actually almost everywhere, especially the evacuation board. Okay, telling people where to gather, where to go. Again, at here, I think most of the time we can see it in the building itself. Okay, and sometimes the signboard might not be very obvious, very noticeable. Okay, but over there, you can actually saw it when you walk on the street. Okay, it's just, you know, outside from certain buildings wall. Okay, or it can be at any tunnel. You can also saw it. Okay. Change of commands as well. Okay, very similar to what happened in Malaysia, which is they do have a medical team. Okay, and they have a psychiatric team itself. So DMAT means Deployment Medical Assistant Team. Okay, so that means that as similar to a lot of places, every time when the disaster happens, okay, medical personnel will be the first one to respond, okay, to the needs. Okay, followed by that, the psychiatric assisted team, okay, will be kind of like going over, okay, to help whatever is necessary. And according to some of their research, okay, this is based on like the feedback from the medical personnel and also the relief worker in disaster situations. So that research telling people, which is like this, they are expecting the psychiatry team, okay, the mental health team, I would say in this way, okay, only started to intervene into the situations after a month, okay, especially in a big scale disaster. The reason given is at the initial point, okay, they are very, very occupied with, you know, like rescuing, doing the search, okay, doing the a lot of like analyze about the place, stabilize about the place. So people at there might not be very open to talking. Okay, so that's some of the suggestions. Of course, it's not like a standard procedure, like, oh, they only go a month later, but this is what feedback by the people at there. So the picture that I show at here is actually an earthquake memorial museum, which is that time JICA, because I'm having a course at JICA, it's actually a few buildings away. Okay, so we came here for our site visits as well. Okay, learning how they deal with disaster conditions. So with a lot of photos. Okay, I just want to show you this one. This is how they make it as something quite like a common knowledge. Okay, it's just that we visit to Museum Negara. Okay, we see how Malaysian's history looks like. Okay, and at here in this museum itself, they are telling people what to do, what is the expectation after a disaster that happened, and this is like a phase of earthquake. Okay, which is quite commonly happen at that. Okay, like post-disaster events and restorations. Okay, and they're providing shelter for everyone. And the temporary houses as well is something very, very fast they can develop that, which is, if I'm not mistaken, in a month time, they'll be able to build all these shelter and temporary houses for their, the survivors. Okay, the reconstructions and return home, the whole process usually only take 3 to 6 months. Okay, to settle down everything. So I think there's a lot of things that we actually can learn from other countries. Okay, in that way. Yep, this is another site visit that I went to. Okay, so it's a landslides affected area. Okay, so a picture at my left or maybe at your right. Okay, so that's like an alarm system outside from the community. How to say, this is like a community place. Okay, so whatever meetings they have, they will come to this house, and any discussion they will come to this house. Okay, it's like a hall, people are using it. So there's an alarm system at here. So every time before a disaster happens, this will be able to detect and also to like alert the citizens around, the residences around, so that they can evacuate. And the picture at the other side, so okay, it's actually a map, okay, a map about houses at the particular taman, okay, and Malaysia I think we'll call it as just taman or residential area, okay. So this information is very important for them, as in like they just need to make sure, okay, during the evacuation process, like who goes first and where they are, okay, and also to tell whether everyone is actually safely arrived at the evacuation center, because they have all the information ready. Okay, I think this is something also Malaysia probably, if we could, okay, to manage about that. I heard about some friends talking about similar things that happen at Canada as well, okay, where there are certain residence area, the residential area, they do have this residence information listed. So anything that happen is very easy for them to detect who are the missing people, okay. So move on to this one. All right, this will be the first thing that I would like to talk about. So the way forward about promotion and awareness. Okay, yep. Okay, after the pandemic, okay, or even during the whole pandemic itself. Okay. Sorry. I think there are people trying to admit. Do I click? Oh, okay, done already. Okay, sorry for the disturbances. Okay, so yep. But I think this is a very, very good opportunity for us to bring PFA forward, okay? Or in the other way, we say PFA, MHPSS forward, okay? To develop informational and community materials for public reference, okay? During this period of time, we do able to have a lot of information like in poster forms, infographic forms, or even videos, okay, that talk about how we can be self-help and also how we able to take care of our mental health, okay? So the information become very accessible to people at a lot of social media platforms, okay? And from my experience in the 2 weeks program, okay, so the disaster education and preparations is not only talking about like how well we can take care of our mental health, but also that will be very important. Remember the PFA concept, provide information correctly. Okay, so that's why teaching people how to identify certain signs of disaster will be also helpful. For example, like flood happening, okay, before that, where are the places that can get some information, okay, from which resources which is reliable, okay, and some sign about, for example, if it's like heavy raining days, okay, like what we need to do and prepare at a certain flood prone area, okay. So second one would be awareness program or campaign in different setting. Okay, not only I think we have to focus at the hospital level or at here we talk about KKM responsibility. Okay, I think it's a very good opportunity if we could bring this concept to the community. Okay, especially at workplace. Throughout my experience in providing PFA at HKL, okay, so we do on and off receive requests from some private company, okay, that they would like us to provide PFA to them, okay. So I'm thinking if we could introduce a program, okay, or to collaborate with these people, okay, maybe we can help to train, okay, their own team to settle the immediate crisis rather than waiting for outsider kind of like help at the moment. Okay, and yesterday, okay, today is 14th of October. Yesterday, 13th of October, is actually International Day of Disaster Reduction. In certain country, they are promoting about disaster education during this day. Like running talks and events, okay, telling people what to do, okay, and how to do. Okay, so I think it's quite a meaningful day. Maybe in Malaysia we could practice that as well. Okay, and especially in October is World Mental Health Day as well. If we can cooperate something similar to this, okay, that maybe we can bring PFA forward. Media appearance, for example, like we can have like a radio announcement about PFA. We can have jingles about how people can easily remember what is PFA for. Okay, jingle is like something like can I say it's like a slogan or something that make us remember about certain things? Okay, it's not proper for me to bring up any company names at here, but you know, there are certain things. Let's we talk about just do it. Okay, I'm loving it. Okay, all these things I think is easily help us to remember what is the particular product is. Okay, and recently we like to use this a lot, which is a hashtag. Okay, so kita jaga kita and something like that, which make people not only the medical staff itself, but also public started to use it. Okay. Accessibility of information at visible places. Okay, I'm thinking about that as in like in what I got from Japan. You know, they make information very accessible at public area. Okay, so probably we can have something like that also. In HKL itself now, okay, we do have this poster which is at the other side. I mean, at my left. Okay, talking about our services at here. Okay, so with QR code, with phone number, okay, with the way how we can they can access to us. Okay, so and also besides on this poster, we do have other poster as in talking about some management, some tips about how to manage your mental health. Okay, also available at most of the entry and lift entrance. Okay, if we can do this more, I think that will be very helpful. Okay. The next one that I would like to talk about will be education and training. Yeah, I think there's a lot of training have been going on. I myself has involved in the training sessions last month. Okay, with my team from JICA and also with NGOs, okay, that we are training most of the PFA provider in various settings. Okay, it's quite a good, interesting sessions as well. So that's another way how we brings PFA forward when we try to have more people involved, more people sharing the information. First of all, probably something we can learn from other countries to include disaster education in school syllabus. Okay. Educate on common disaster in Malaysia like flood, fire outbreak, landslides. Okay, what is that? What are some of the early signs of it? Okay, what are some of the risk factors of that? Okay, and how people should respond to that. Okay, I think that will be very helpful. Okay, so relevant information to identify potential risks. Okay, and safety management. Like where they can go, okay, especially if like a small residence area or maybe in a kampong or village, okay, like where they can get help from and where they should gather together, okay. Because we are trying to introduce PFA from younger age, okay, maybe something like a social stories, okay, or maybe a small booklet will be helpful with the kids. Regular drills with families with disaster. Okay, again, okay, shared about my experience in Japan. So, what's happened in some of the community center? Okay, they will run disaster drills. Okay, consistently in a particular area. So, for some places where they have this OKU people, as what we will say in Malaysia, special needs team of people, okay, they will try to identify where are them, which houses they are in, okay, so who have to be in charge to take care of them during the evacuation process, okay. Usually will be the neighbors nearby, okay. So there's a card, a small picture of card here. This is something development that it could be very different compared to a different community, but the information will be similar, which is that they no photos, only names and where they are, some contact numbers, okay, which house they are staying, and also at the big column there, usually they will put down some of the information about the special conditions. Okay, that time we are given one example as in like, let's say if a particular house with kids or adult with autism spectrum symptoms, okay, ASD. So the information will be something like, oh, I'm having ASD, okay, I'm sensitive to loud voice, okay, so please don't call my names very loud, okay, but you can choose to use such a method to reach me if it's in the crisis situations, okay. And for elderly who may need extra attention also, they will be written on a card similar to this as well. Okay, if we could also start something in this way, for example, at probably a bit difficult for landed house because the area coverage will be a bit big. But let's say at those condo, those building, or even at the workplace, okay, if we able to apply something like this, I think it will be very helpful, okay, for us to save or maybe to support more people later on. Training of PFA for specific personnel, okay, introduce PFA education to wider population, like I just mentioned, okay, so PFA is not only for mental health professionals. If we as a mental health professional, we could provide more training to a particular places, and they will be able to take up the role and provide immediate help while waiting for us to arrive, okay? And also, I think in the way we can help them to set up a task force or maybe special team, okay, at a particular setting in responding to the aftermath crisis. All right, okay. So particularly for petugas kesehatan next year, okay, so I think we have been providing a lot recently to, different way, very innovative ways, okay, how we can help the petugas kesehatan in different settings. So this, for me, I think include disaster education and staff orientation, okay. Like HKL itself, or maybe HDA as well, is quite a big hospital. We do have staff rotation. We do have new staff reporting, okay, very frequent, in maybe in a monthly or maybe in a half a year quarterly time. So if we can include the disaster education for this staff during the orientation week, do you think it will be helpful, as in for them to know, okay, when disaster happen, when the fire outbreak happen, when they hear about all these alarm and things, what they're supposed to do and who to get help, who to contact. It's similar to Code Blue, okay, in certain in the hospital, but if we could also include this inside, maybe it will be helpful. Continuous medical education or workshop to enhance PFA, yes, okay, I think we've been doing that also, okay, but maybe can do more, as in to reach to more departments, okay, more stuff, okay, not only for the doctors, but also for the supporting staff. I think they are very helpful every time during a disaster that happens, because they will be the main group to directly involve with patient care, okay. Buddy system for each ward or unit in the facilities. Yeah, I've been thinking about this for long. Okay, I'm sharing with my new coordinator as well. This is what we are thinking. Would that be a way that we can help to develop like a buddy system in the unit, okay, or in each of the ward? As in, we will pick, one representative from each unit or ward. Okay, then we provide training to them, and then this particular person will bring PFA back to their unit or ward. Okay, as in like they already able to do something again before they need to call the main team. Okay, especially during the pandemic itself, okay, like social distancing, okay, and a lot of restrictions, especially when lockdown happened, it's hardly for the main MHPSS team to reach to them immediately. Okay, especially when we don't even know what is the condition that happened in a particular place when it's been locked down. Okay, so in this way, if we're able to train a particular person, so that person can take immediate action and contact with us if there's anything needed. Okay, I think this is supposed to be something way forward. Okay, for some of the Ketua Jabatan, if there's anyone at here, maybe to consider about that. Okay, I think we will be very happy to provide the training and support to your team. Okay. Environmental modification to allow space for staff to talk or have me time. Yep, okay, we know that rooms, facilities are always something very challenging in a hospital setting. Okay, at here we are not talking about having like a big room, okay, that they can sleep, they can have massage chairs and things like that, but just something like a corner. So the picture in this slide, okay, is actually taken in the Mercy shelter, or maybe I should say mercy camp that recently set up in HKL. Okay, so they have coffee machines, they have some snacks at there, comfort food. Okay, so anyone can just visit and enjoy yourself over there. But similar setup, I guess, is has no issue that we can actually do it in our own setting. We just need a corner. Okay, and the corner we just require maybe a chair or two. Okay, to allow the staff to rest for, let's say, 5 minutes. Okay, 5 minutes, I don't think it will be affecting a lot if the staff are aware about, okay, these colleagues are not in a very good condition, maybe just take a 5 minutes break, okay, and we be more alert about covering the jobs. Okay, communication. Okay, communication very important. That's why communication is always one of the important topic in PFA. Because I have heard comments about why we need to include communication in PFA. Okay, I mean, we all know how to communicate, especially if we are training on the mental health professional. We all know how to talk. Okay, but the difference will be is the way how information will be accessible. Okay, so that's why I say make PFA comfortable and accessible to all of us. Okay, so. Well, talking about research and innovative, okay, so they are research actually at international level, even in Malaysia itself. Okay, talking about PFA, but in Malaysia, I think it's more about the narrative data. Okay, at the moment, not so much on like how the effectiveness of PFA in the local context. I guess maybe some people are doing it. I'm not so sure. Maybe not published yet. So. Why these things are important? Because sometimes when we offer a service, okay, we have to know the measurement, as in like whatever that we offer, is it suitable? Okay, like to which extent, to which skills, okay, that we need to extend our service to the people involved. Okay, so by doing assessment at the moment in HKL, for example, like the DAS, okay, previously we're using the DAS 21, which I think some of you might be familiar. And also we are using K10, okay, recently we're using K10, which is the team who came back from Japan. Okay, we get the idea from the team over there to use K10, okay, to help with Kessler 10, to help with people who might have showing some symptoms. Okay, and so far I think what we are managing, managed to do will be just for a pre-screening. But I don't think we are able to cover for the post-screening so far. Okay, maybe this is something for us to look forward. Okay. Modification in ways of accessibility for PFA services. Okay, yep. Okay, we are doing all these virtual tele discussions. Okay, as much as possible. Okay, activity-based program in implementing PFA. PFA most of the time, there will be a lot of theories involved, like steps, okay, talking about skills, introduction about the particular terms, okay, talking about the definition itself, okay. So that also important, the theoretical background, okay. But we also have to look at this, which is the some more interactive based activities. Okay, the picture that I show it here is actually an activity called Crossroute. Okay, that I learned from Japan. Okay, there's a professor that's developed by two professors. Okay, so the purpose of them using Crossroute during PFA services is, all right, so usually there will be a lot of discussion, okay, when we have to talk about PFA, like what to do and what should do. Okay, and it might involve a lot of like the ethical issues like that. Okay, or talking about personal choice or personal preference. For example, I give you a condition where if you as a healthcare provider, okay, your house was badly affected during the flood situations, okay, but at the same time, your leader is calling you to go back to report QD at the hospital. Okay, a very simple situation. I think maybe some of us do face that. Okay, so the option given is that, yes, I will go back because my work is more important as I have to serve. Okay, as a government servant, I have to serve the public. No, as in the way I have to take care of my family first before I can offer help to other people. Okay, in these situations, okay, usually we separate into two main groups, okay, how these people will debate over their options, okay, and in the end come up with the conclusion as in like there's no absolute right or absolute wrong in providing PFA. It's really depending on what is the priority of the particular person at that particular moment, okay, depend on the needs, okay. Sometimes it could end up into a big argument, such as I tried that with, I mean, in some of my training happened at here, okay, so that's in the end up in a very hot debates, okay, but of course it's not like arguments that make people angry, but it's more like they are trying to fight for ethics, so okay, they're trying to fight for what is the works ethics and personal ethics or professional ethics, okay. Another way that I would like to suggest, okay, would be the technology assisted method, okay. I think in this era, I think in these generations, be able to use technology assisted method will be very, very helpful. Okay, as I just mentioned, we put things into like videos. Okay, I remember there was a team, I can't remember which hospital, they are using animation, they are creating their own characters. Okay, introduce about PFA, introduce about mental health care. I think also a very interesting point to reach to the public. I put down here my Tracher apps, okay, it's actually by government, okay, so in this app itself, the public supposed to be able to access to some information as in like high risk for landslides, okay, high risk for a lot of reasons, okay, that how people should be aware, okay, but I think this is still in process of improving, okay, so the apps heard comments seems like there are ways that people are providing feedback like how to make the apps much better and much useful. In Japan and some other country, I remember I attended a conference before, I think they are using, I think it's Korea, they are using also Awata, okay, Awata to introduce about mental health to people, introduce about PFA to other people, okay. This will be my last slide. Okay, so talking about collaboration. So I think another way to make forward for PFA is, as I mentioned before this, is no longer something like only KKM or MOH supposed to take full responsibility. Okay, we should put this into like identify some of the stakeholders, okay, for the purpose of, okay, if we could discuss with them to incorporate psychosocial response into their organizations, disaster management, okay, or their operation plan, that will be much better. Okay, at least when something happens, they immediately will remember to activate the psychiatry team or the mental health team, okay, depending on what the facilities that they have, okay, like what's supposed to be done, supposed to be offered, okay, to people who involved. And the important things that here is not only to provide to the survivors, but also we have to focus on the relief worker itself. According to the PFA concept, relief worker, which is at the, it could be, you know, other organizations as NAGMA, IMARE, okay, or even the police force, the army force, or even PFA provider like us, okay, we are actually at the fourth category of victims, okay. So to incorporate the psychosocial response is actually to help with the staff as well, okay. And also, I think this is something that actively been practicing in KKM now, in collaborating with all the other ministry, other commentarian and also other agencies, which is to include PFA as part of that training. Okay, me as one of the team. Okay, sometimes we do helping. Okay, that's in going to their place, or now we do it virtual most of the time to bring PFA to their staff. Okay. For educators to bring PFA and disaster education as part of school curriculums, okay, again, okay, because I already mentioned just now. So for school syllabus, okay, at here, mostly we are not talking about theory sharing, okay, it's more about like how to bring activities, okay, it could be all kind of activities, including drawing, singing, okay, or even relaxation techniques can be so much different and fun, okay, when we do it for children, okay. And One last thing that I would like to mention that here will be the collaboration with media. Okay. I think it's time for us to look at not only on some of the specific mental health concerns, but also in PFA itself when a disaster happened. Talking about the responsible news coverage, okay, and with the accurate information provided from authority. Okay, if we could make a common understanding between the media with some of the authority, okay, as in what to cover and what are the focus to report to the public, okay, in order to prevent or avoid secondary trauma to wider populations. Okay, a lot of time is not only the survival itself that might involve, but sometimes you could probably see, how to say, as in like, probably you have nothing related to the disaster itself. You do not know anyone that involved in the disaster. Okay, and probably is far away from your place. But because of the repeating news and repeating pictures or information that you saw, somehow you got mentally affected. We do have cases referred to the hospital setting where they are afraid of taking flights, okay, after the MH incidents, but they have nothing related to that. But because of the news, the pictures, they make them so afraid, and in the end, develop into some phobia. Okay, so this is also something that we have to deal with. Okay, so with that, okay, with that, I will just end my sessions at here. Okay, thank you for all the attentions given. Okay, I hope my discussion at here will bring some benefits to you. Thank you.
Thank you very much, Ms. Chan Pek Ha, for the delightful talk. Now we can understand more about the FA history, how it evolved, and how important it is, especially in responding to disaster. Okay, now we can have our last topic and our last speaker. Our fourth speaker is a medical officer who is currently working at Hospital Tunku Azizah. He graduated with a medical degree from Malacca Manipal Medical College. Has been working in the field of psychiatry and mental health for over 10 years and has served previously in Hospital Sentosa Kuching, Hospital Miri, Hospital Kuala Lumpur, and University Malaya Medical Center, UMMC. So without further ado, I would like to invite Dr. Kevin to deliver his talk with a topic #Kita Jaga Kita, Self-Care and Psychological First Aid for All. Dr. Kevin, the screen is yours.
Okay, thank you very much. Hope you can hear me clearly. So I will share my screen now. Okay. All right, so we had a very interesting day today. Thank you so much for Dr. Ramli and Dr. Nurul Nadia for the introduction and the opening remarks. And then, of course, we were all awestruck by what Dr. Salina, our head of service for psychiatry, had to say. She made a lot of very interesting and very pertinent points that mental health should not be taken for granted, and regardless of whether there is a pandemic or no pandemic, all psychiatric services must run and must continue to run. And I think I'm proud to say that HKL and the HTA, despite being completely overwhelmed by COVID a few months ago, we still managed to somehow continue services, and our wards, even though we were affected by COVID, we still did not close our wards down. We had patients with COVID in the wards, but we still managed to continue to manage care as well. Dr. Anita talked, of course, about children and mental health, and also the great inequalities that we see. And both Dr. Salina and Dr. Anita talked about adverse childhood experiences, something which we need to do more seriously. And Ms. Chan, who is one of our pioneers for psychological first aid, has explained to us how we needed to evolve our psychological first aid from the early days, from her early times in Japan, to now how we manage COVID and how do we give psychological first aid for us. So here's now for me, what I'll do is something fairly simple and fairly lighthearted. Psychological first aid used to be a complex and a complicated thing which required training, which required courses, and it still does actually. But now, since COVID has come down, we are now faced with the horrible reality that, we have tens of thousands of backlogged cases which are awaiting our urgent needs. So in addition to COVID related activities, we also have to go back to our core duties, not just in psychiatry, but also in all other fields of medicine. So we had the hashtag Kita Jaga Kita for quite some time. And so what are we talking about now is more of self-care. How do we look after ourselves? And how do we administer some form of psychological first aid for not only ourselves, but for the people around us? Okay, so our almost most recent statistics. So as of 12th of October, good news, 10,000 people have recovered. Bad news, we are still having 7,000 plus local cases, but the number is dropping day by day. The deaths have also dropped. The most important thing for most of us who are listening right now is the number of fully vaccinated adults have reached over 90%. So 90.6, I think it's a little bit higher today. So what that means is we can now cross state borders. And please listen to our Minister of Health. Jangan lupa ya, sila patuhi SOP yang telah ditetapkan. Because what we are extremely concerned about is that we will see something like this actually starting today or tomorrow, especially since next week Tuesday happens to be a public holiday as well. So everyone, please stay safe. This might not be the best time to travel despite having a kind of long weekend. Okay. And even though when we travel, when we can visit our loved ones and the ones that we care about after missing them for so long, we still need to be very careful. We still need to maintain our SOP. And if we are not feeling well, please test ourselves and, self-quarantine ourselves in case needed. Even though we are temporarily having some release from the pressure that we've been over the last 2 years, and especially over the last 3 months where there was no light at the end of the tunnel, we still must not neglect COVID-19's impact on mental health. So even though things seem to be getting better, there is still a lot that still we see on a day-to-day basis. There's a lot of anxiety. There's a lot of perceived loss of control. Things change on a daily basis. Our SOPs change on a daily basis. Our permissions and what we need to do change on a daily basis. We blundered in the beginning. We talked about the social distancing, and that led to social disconnection and isolation. The proper term which was introduced a few months after that was physical distancing. So that, even though we may be apart physically, we can use technology and other means to, connect with each other socially. Fear, like hysteria, is kind of contagious. So, and WhatsApp groups and, our aunties and uncles sharing all kinds of things spread fear incredibly fast. And with no reputable source, it's kind of difficult to debunk these fears and worries. And of course, with such a staggering death toll that has affected Malaysia, there's a lot of grief, a lot of people who have lost their jobs. There's a lot of economic strain and unemployment, like Dr. Salina previously talked about. And Dr. Salina also talked about, and Dr. Nurul also talked about, when they were all cooped up in their houses, hopefully not anymore. The houses which were supposed to be a safe place turned to be unsafe. So there was intimate partner violence and there was also child abuse. And of course, so of course, who are the people who are higher risk populations? Well, those who had mental illnesses previously, they were at higher risk, especially when, hospitals became full COVID and, services were shut down. healthcare workers, the frontliners, the police officers, the bomba, everyone that dealt with the crisis on a day-to-day basis for so long, they are at higher risk. And I believe now is actually a kind of critical time for them, because they've been so strong for so long. They have managed to look after everyone else except for themselves for so long. But now when things are cooling down, only now they have the time to take a step back, take a breath, and to actually feel all the rush of emotions, to feel all the hurt, the pain, the grief that they have been feeling, and that they have been suppressing all this time. Okay, youth and older age adults. Youth, we have lost almost 2 years worth of schooling. Our SPM has been pushed back about 2 years. Our older age adults, they have been cooped up at home because they are at higher risk. Yep. And working parents with school age kids, again, like Dr. Salina shared with us, it was incredibly stressful, that they had to not only work, but also look after their school children. They had to make sure that they were sitting down paying attention during their online classes. They had to make sure the kids submitted their homework. They had to make sure the kids were not watching YouTube when they were actually supposed to be on Google Classroom. And at the same time, complete the work assigned to them by their bosses. And some of the bosses were understanding and some bosses were not, and wanted to micromanage and said they had to have their camera on and they had to watch them at 7:30, 8:30 in the morning when they're supposed to work. Hopefully things get better now that our vaccination rate has gone up. However, we still cannot let our guard down, especially since more and more people are now going back to work. So yes, this is perfectly normal to feel all these emotions. A lot of us felt these emotions during the pandemic, especially the general public. Grief, guilt, anger, fear because we weren't sure what's going to happen. For the frontliners, a lot of us did not have the luxury, and we still don't have the luxury of allowing ourselves to feel emotions, because we just have too much to do and we are running from one crisis to another crisis. We are putting out fires on a daily basis, so we are not allowed to express ourselves. And I think this is what our psychiatry department and what Ms. Chan Pek Ha and our psychological first aid team will be working on as time goes on. So many people have died. For those family members who have lost their loved ones, they can grieve at that moment. Healthcare workers, unfortunately, we don't have that luxury of time to grieve for those who passed away. Because if we grieve, then we are unable to take care of the next case and the next case and the next case after that. We all feel very guilty that we were all so overwhelmed a few months ago when there were just too many cases coming, and we had to triage and palliate so many people whom, if things were different, if situation was different, the outcomes could have been different. By the peak of this year's cases, there was a lot of anger. There was a lot of people very frustrated regarding the system, the leadership, the frequent U-turns. Fortunately, I think this has calmed down, especially now that things are seem to be more under control. Uncertainty has always been there. Things have changed on a daily basis, and the headache is with enough trauma, with enough bad news, with enough horrors that we experience on a day-to-day basis, especially for those on the front line, we become numb, we become detached from the situation. I'm sure you've all heard of the stories of our police officers manning the roadblocks. They come seeing us doctors during the roadblocks, they are crying because they have had their leave frozen for months. They have not seen their families in across the state for months, and they just see no end to the amount of work that they are doing. And of course, after you become numb, that's when all the trauma starts to catch up with you. You can't deal with it consciously, so you deal with it unconsciously. So you have nightmares, you have difficulty to sleep. Either you eat too much or you eat too little. So yes, a lot of us are sad. And I'll try to do here in the next half an hour or so is teach you some techniques, give you some resources, and to counteract all the negativity that is around, that is spreading on Facebook, on WhatsApp, on especially on WhatsApp. Try to give us some hope, and also try to give us some other safer, more informative, and more factual places which we can actually visit online, because since social media is a tool that works both ways, we might as well try to use it for good instead of for ill. So yes, I'm sad. One of the things that we can try doing is try adding for now. So we can say, I'm sad for now. I'm angry for now. I'm frustrated for now. And realize that, even though we are we were in a very huge storm, that was at that point in time. So hopefully we can change for now to I'm sad before this. And of course, we know suicide cases jumped tremendously in the first quarter of the year. It almost, it increased tremendously. And the latest statistics we haven't managed to collect. Hopefully, it is coming down with the drop in the number of cases, with the improvement in the economy, with the ability of us to actually visit our loved ones. But again, please be careful and make sure you maintain your SOP. Okay, so what can we do? Good news, most of us are all vaccinated. Great news, we can now travel the state, interstate. But at the same time, there's a lot of people, especially those who have suffered COVID. They have long COVID. They have, still having cough, persistent cough. They have persistent lack of energy. What do we do? How can we help them? The simple short form answer, of course, would be to refer them to the psychiatry and mental health department, the nearest one near you, to go to the nearest clinic kesehatan. There is guidelines for that as well. But as we can see, because there is such an overwhelming amount of cases, what I hope to do is hopefully give you some websites and some simple tips that you can do, that you can help other people, but more importantly, you can help yourself when you are faced with these kind of situations. So a lot of times when there's a panic, when a disaster happens, everyone wants to do something immediately. Everyone wants to do something fast. Everyone wants to be seen doing something. However, this is not by Winnie the Pooh. I'm not sure who this is by. Don't ever underestimate the value of doing nothing, of just going along, of listening to all things you can't hear and not bothering. Because if you listen to too many things and you rush around too much and you panic too much, sometimes you might do things which you may regret later on. You might say things which you regret later on, or you might burn bridges which you should probably avoid doing. And just because you feel sad, you feel frustrated, you feel stressed, some people may feel joyful, some people may feel calm. It's completely normal to have all these range of emotions. This does not mean you are mentally ill. This does not mean that you are weak. No matter whether you're a man or a woman, no matter what race you are, no one is super at all times. You must take the time to look after yourself. You must take the time to care for yourself. At the start of the pandemic, one of the common phrases that the emergency doctors and the physicians kept on emphasizing to all of us is, there is no emergencies during a pandemic. okay, and that you have to take care of yourself first. You have to put on your PPE, even though the patient was, collapsing, even though the patient needs CPR, you had to put on your PPE properly. Then only you could enter the room to administer CPR, to administer care to the patients. I believe we should extend this analogy to mental health as well. We see every day on the day-to-day basis, healthcare workers and the members of the public who are having a wide range of very negative emotions. They are totally overwhelmed, they're totally exhausted through all the trials that they are going through. However, again, we want to say that there is no emergency during this time as well. So we must be strong enough. We must be mentally resilient enough. We must be able to take care of ourselves. We must put on our own mental and emotional PPE on first before we help others. If not, what usually happens is a quick road to burnout. We will feel too busy, we will feel too overwhelmed, our usual coping systems will break down, and just like the healthcare worker that rushes into a collapsing patient without PPE, you might also develop your own mental health issues, and that may also cause even more burden to the people around you. So yes, KKM has fully acknowledged that mental health is an important issue, and they have launched the campaign Minda Sehat, Let's Talk, with the hashtag Kita Teguh Menang, Kita Teguh Kita Menang. So please visit KKM KKM Facebook and KKM Instagram to get more information there. And depression can happen to anyone, and it is not a sign of weakness. And the thing is, the more we look at depression, the more we look at anxiety, the more we look at mental illness, it turns out it's more of a spectrum. And the old ways of looking at depression, anxiety, and even autism spectrum disorder may not be so applicable anymore. For instance, the concept of a high functioning anxiety, high functioning depression, it is becoming more and more common nowadays. Same with adult ADHD. The headache is if we use our old diagnostic criteria. The definition of high functioning depression means you can function socially and occupationally well, which means you do not qualify for your DSM-5 diagnosis. So this is something we need to think about a lot more. So if you end up in a psychiatric clinic and you don't fulfill that diagnostic criteria, there's something that the mental health community needs to think about. What can we do to help in these cases? Again, sharing from Public Health Malaysia, masalah mental bukan satu trend atau ikut urutan, bukan satu tanda tak cukup iman, that has been said before. Bukan sesuatu yang boleh hilang sekelip mata. It's not like the psychiatrist is a magician and we say some magic words or we give a magic tablet and you feel well again. I believe there were cases where people coming in with severe adjustment issues who were unable to work, who were healthcare staff who were sent to psychiatry. I think they were expecting a single session of counseling and that the person would get better immediately. Instead, we realized that she was unable to function because she had too many social issues going on at that moment. So when we gave them some medical certificate just so that she has time to process all the emotions that she was facing, they were shocked. How come you give MC? I thought after seeing psychiatry they will be better immediately. Mental illness is not a choice. It is also not an excuse. And sometimes you can smile, you can be friendly, you can, joke around, you can, function as normal, but you may still have mental illness. And it's not attention seeking for the most part. And it doesn't mean that you are weak. It doesn't mean that you are lacking. We need to emphasize this message along strongly because That's what some of our healthcare workers think. And if this is what our healthcare workers think, if this is what the general public think, then it is very simple. They will not come to us to seek help. They will not admit they have a problem. And like Miss Chan Pek Ha said, most of the time, whenever we ask any healthcare staff, are you okay? They will always answer the same thing. I'm fine, I'm okay, even though they are crying in the corner, even though they are crying in the staircase, even though, they haven't had time to, eat, sleep, go to the toilet, they'll still insist that they're okay, mainly because, they think that, if they show that they have any mental health issues, that means that they're weak, or, that they're doing something wrong. And yeah, so Instagram is an interesting place, and there's a lot of very interesting websites out there. For those who are more graphically inclined, more visually inclined, and they have a lot of quotes which may resonate with a lot of us, if we know where to look and if we know how to look. So as far as I know, we're all a little broken. But the last time I checked, broken crayons still color the same. Same way that, we may be a little bit broken inside, we may be, suffering from grief, we may be suffering from burnout and overworked, but we still can play our part. We still can, do our jobs. And of course, especially now when things are cooling down, when things feel just too overwhelming, when there's just too many meetings to attend, when there's just too many talks to give, when there's just too many patients to care for, when there's just too many elderly people to palliate previously, just remember, step by step, one day at a time, one task at a time, one thought at a time, one moment at a time. Easily said, very difficult to do, especially when your phone is ringing completely off the hook, but you still need to slowly practice, and hopefully this helps. And of course, it's okay to be sad. It's okay to be overwhelmed. It's okay to feel overworked. It's okay to feel that life is unfair, that other people are doing less work than you, or other people are relaxing while you are busy running around, fighting fires, and seemingly doing everything for everyone else. And of course, here's something that we can do to help other people. Usually when we ask, are you okay, everyone will answer, I'm okay. And we pretend that they're okay, and then we pretend that we've done our part. So here are some simple ways to check in without asking, how are you doing, or are you okay? Some people, they prefer you to share first, before then only they feel secure enough to share what they are feeling. So offer some insight to how you're feeling first. For example, you can say, I've been having a hard time sleeping and focusing on work. Work has been piling up, but I think I'll be okay, but it's really been tough. So how have you been feeling? So when you share your own feelings, you sort of create a safe space where, they can feel safe to share their own feelings as well. Ask something specific instead of, are you okay? Then everyone answers, I'm okay. What have you been thinking about? Or how has your day been? This is a good thing to practice with your children and your spouse, when you come back from work. How has your day been? So you can get to connect with them. How does it feel to be with you right now? Sometimes people are lonely. Social distancing means, they've been locked up in the house, and, they've got nothing to do but read anti-vaccine WhatsApp messages, which, promote, ivermectin, and, it sort of warps their mind if you keep on, seeing the same thing over and over again. You can offer an activity to do together, but make sure you follow up, otherwise they feel even more lonely. So I think one of the new things which they do is watching movies over Zoom, or watching movie, or using Netflix and watching the same movie at the same time, and at the same time having a video call at the same time. So even though you may be very far apart, you can still have some form of connection. offer support. But the thing is, when you offer support, which most of us do, we offer support, but we also want to offer advice, we want to offer answers, we want to offer opinions. So offer unconditional support without questions. Some common things we can say is, I'm missing you, I'm just checking in, I hope you're okay, but I'm here for you if you have any issues, if you're struggling. So that leaves the door open, and that doesn't feel like you're forcing them to disclose things which they are not comfortable disclosing. Be curious. I'm wondering what's helping you cope right now. This would be a good one, because not only you find out how they cope, you might actually learn a new coping strategy which might help you as well. None of us read much books lately, thanks to Kindle and thanks to Facebook and Instagram. But another good thing we can ask is, have you read any good books or watched any good shows lately? Squid Game is probably not a good movie to watch at this point if you're not feeling too mentally stable. Okay, so this has a double meaning. A person has two hands, one for helping himself, the other is for helping others. So for all the frontliners, for all those in the emergency departments, for all our police, our bomber, our whaler, you have used your hand for helping others so very much. Please don't forget that you have your other hand and you need to help yourself as well. Because if you burn out, if you end up too exhausted, if you are unable to cope, it really doesn't help anyone. So what can we do from a practical aspect? Instead of focusing on what we can't control, which is, the massive traffic jam that may be starting today, tomorrow, or the day after, we focus on what we can control. Maybe staying at home is a good idea. We should try to find a way to lead a normal life in this new normal. If we don't take control of our time, usually time will end up taking control of us. So we need to find time for ourselves. We need to find time for our families. We need to find time for our friends. This pandemic, when we were all locked up, good news is a lot of us engaged in quite a lot of healthy activities. The number of people walking, running, jogging, and cycling improved a lot, since there wasn't much places that we could go at that point in time. Sleep, not so much, since Netflix and Disney came along. Sleep and binge watching don't tend to go along with each other. Unfortunately, alcohol consumption also increased. Connecting with others, in the beginning, that was difficult, especially in the first year or the first year and a half, but we soon slowly adapted, and video calls, video chats, there are even kids apps, surprisingly, called Kids Talk, where kids can safely communicate with their own friends. Mindfulness and deep breathing, this is a bit more of a challenge. Psychological first aid does do a bit of that, I think, but that's definitely something we need to look into. And the good news is there are many websites, there are many Instagram accounts that do teach us mindfulness, deep breathing. There's also many apps that we can download that also does teach us a fairly well how to be mindful and how to do deep breathing. Media intake, social media, I'm thinking we are going to lose this battle because everyone is on social media nowadays. The thing is, instead of focusing on doom and gloom, instead of focusing on what used to be rising numbers, we can carefully curate what we see. On one hand, that might mean that we are in a bubble. On the other hand, it means that the social media can be a source of positivity. It can be a source of hope. It can be a source where we can actually learn new ways to handle things in a time when things change on a day-to-day basis. Routines are always very important, especially, with work from home, with learn from home, with all that. Evidence base is quite clear. Sticking to daily routine helps promote normalcy. It helps reset our circadian rhythm. It helps maintain our emotional regulation. And sleep, especially nighttime sleep, is actually very beneficial for our mental health. Since most of us work at home or study at home, we had to find ways to adapt. So we needed to make our environment comfortable and also safe. We needed to find our own SOPs at home so that we could be productive and we could find the most efficient and the most comfortable way that we can settle the things which we used to be able to do outside. And of course, if we are unable to manage, then we should seek support, tele mental health services. Again, KKM has websites, Mercy Malaysia has websites. At the end of my slides, I will give you a few more links which you can connect to, all of which promote very healthy mental health, promote good mental health, and provides avenues for you to connect to people if you so need them. So yes, don't devote every minute of your life, this is for all frontliners, to battling this horrible disaster. It has been an extremely long, drawn-out siege. It's probably going to change in the next few weeks and months. It's going to change more in terms of less COVID, more of our core services, which we've been putting off for the last 1 year. So again, even though we want to rest, we want to take our vacation, we still need to conserve our energy and we need to pick our battles wisely. This is Hope talking. This is also George Bonanno talking from last year's ECNP. Most people are actually resilient. Most people, they do not need treatment, they do not need medication, they do not need long-term follow-up, but they do need to express themselves at the right time to the right person without judgment and without unhelpful or without unhelpful advice or without criticism. We need to respect them. We need to respect their autonomy. Some people prefer not to share, and that's okay too. However, we should seek help quickly if there are persistent, pervasive symptoms with suicidal thoughts. And yeah, we still have our walk-in clinics, and we still will try our best to help. So yes, please look after yourself. Please give yourself love too. And sometimes in order to get through life, you have to be kind to yourself. And being kind to yourself doesn't just mean going on Shopee spree, going on Shopee 10 shopping and buying a lot of gifts. Sometimes it just means telling yourself, it's going to be okay. I'll get through it. It means acknowledging your feelings. It doesn't mean repressing your feelings. It doesn't mean that, you are not allowed to feel sad or angry or frustrated or hurt or betrayed. It means that you must have love and patience for yourself. It means accepting yourself the way you are. It means accepting other people the way they are, and accepting that you can't change them no matter how much you would like to, no matter how unhealthy it may seem to be. There are a lot of Instagram pages with some comforting words which may resonate with you. Healthcare workers, for the most part, they look after patients fantastically. They look after their friends wonderfully. It's just when they comes to treating themselves, it's a bit more difficult. So it's a bit of a paradigm shift. You need to treat yourself like a friend. You need to care for yourself the same way you care for your best friend. Physical comfort is kind of difficult in these pandemic times, but hopefully most people do have a loved one which they are staying close with, that are considered close contacts, that that they can seek physical comfort if it just becomes overwhelming. And that's why it's important to love yourself. Because self-love is building the courage to be honest with yourself. It's being honest about the mistakes you made. It's being honest on how you can change and the areas that you need to go within yourself. Because if you don't love yourself, you most probably will keep Well, lying to yourself, I'm okay, there's no problems with me, everything is fine, I'm not making any mistakes, everything is going correctly, my decision making capacity is perfectly fine. I don't need to change anything, because uh I have done nothing wrong, and I don't need to go. So you need to love yourself, you need to care for yourself, to be honest with yourself. And when you're honest with yourself, that's when you can start to grow, that's when you can start to change. Okay, and if you love yourself, well, if you don't love yourself, it's going to be difficult to find other people to love you. So loving yourself helps boost your self-esteem, it helps boost your confidence. If you care for yourself, obviously you become more productive. Your feeling of fulfillment is there. You feel that because I love myself, what I'm doing actually has meaning. And of course, loving yourself decreases the amount of stress in your life. Self-care, self-love, and loving yourself also helps you become more resilient. And once you have, besides the big love we have for everyone, if you have the small love within yourself, it tends to radiate outwards. So it's contagious. If you project an aura of calm, if you project an aura that you care for yourself, it also will show that you care for others. And once it starts with you, once achieved, it ripples outwards. It's the exact opposite of panic. If you panic, panic is also contagious. People see you panic, they also feel panicky. And of course, loving yourself also helps you see yourself as the important, worthy person that you are. So what are the statements that we can use that, help validate us, that help us make us feel not so miserable, that might help us get us through when, we are totally overwhelmed? It's okay to say, I deserve rest. It's okay to say, I need leave, I need to take a break. It's okay to cry. Okay, it's okay to cry by yourself. It's okay to cry, with someone you feel trusted, you trust. It's okay to acknowledge that, you're doing your very best at this point in time. It might not be what other people expect, but this is your best, and you know that you're doing your best. So you need to acknowledge that as well. You need to set boundaries. You need to be able to allow yourself to say no. You need to be able to not link your self-worth with saying yes to everyone all the time. You need to be able to realize that your voice matters, that what you say is important. You must not let other people, technical term here, you must not let other people gaslight you to feel that what you say doesn't matter, or doesn't have any meaning. Self-love, self-care means that you're proud of yourself, you're proud of what you're doing, not arrogant, just proud. And it means that you're acknowledging that you're having a hard time, and that that even though you're doing your best, you are still having a hard time, and that you are enough. You are okay as you are, and that you will get through this, and you may be sad, but you may be sad for now. So what can you do when you feel sad? Crying releases endorphins, so crying does help. Moving through it, dancing, walking, all that movement does help also reduce the endorphins. Now we are allowed to go outside. Please practice your SOPs, wear your mask, go outside, see the sunrise, see the sunset, look at the sky, see the clouds, accept what you're feeling. A lot of times we repress what we feel. We repress the anger, we repress our sadness, we repress our frustration, and with enough repression, it externalizes or internalizes in ways that we don't really, that is not very healthy. One thing that does help is journaling, writing down your thoughts. It certainly helps me as well, especially when I see my patients. I see them and I focus completely on them. And then once I write out my case notes, usually I transfer all my feelings and my emotions and my notes to them. Meditation or prayer does help. That's probably going to be a whole topic some other time. Talking to people is important. But again, you have to find the right person. You have to find someone who you trust. You must find someone who you trust. You must find someone who does not judge you. You must find someone, who just is not there just to listen, just to speak. So sometimes we can preempt them by saying, I'm having a hard time right now. All I need from you now is just to listen. I don't need advice from you. I don't need anything. I just need someone to listen. And, with everyone being vaccinated, hopefully you can find someone to give you a really big hug whenever you need to. Again, don't bottle up your emotions. It will come out one way or the other. Don't bottle up your sadness, stress, anger, worries. I'm kind of concerned regarding the frontliners that we have out there because they've been bottling it up for so many months. Now it's going to come out eventually, and hopefully we'll be there to support them if and when it happens. Again, from Let's Talk, Minda Sehat, kita tunggu kita menang. What helps people recover from depression, from anxiety, from mental illness is support. Support from friends, support from family, support from, there are many support groups out there on the internet. Just make sure you join the right one and not one which promotes things which are not so helpful. So what can we do instead of lashing out, instead of keeping things all to yourself? So these are some alternatives. Instead of sending an impulsive, long-winded text at the wrong time, at the out of working hours, write a note to yourself, journal yourself, express your emotions to yourself. And you find that when you write it out to yourself and when you read it out to yourself, you might realize that sending an impulsive text might not be the right thing to do, and might cause more harm than good. Lashing out at a loved one is sometimes something that we do, especially when we are frustrated and people are there at the wrong time and at the wrong place. Now with the relaxation of physical distancing, you can go for a walk by yourself. The movement helps calms you down. The movement releases endorphins. The movement helps you put your thoughts in order. And heck, when you're on a solo walk, you might have a solo conversation with yourself. So instead of lashing out at a loved one, you might be able to sort things out by, talking internally to yourself. Bottling up your feelings, like I said, is a bad thing to do. Listening to your favorite music sometimes helps, because it gives you the feeling of connection. Sometimes your favorite singers or your favorite artists are actually also going through depression at the same time. They're also going through anxiety at the same time. So when you listen to them, they're actually pouring out their emotions through their songs, and you can connect with them. Going into an overthinking spiral, that happens to a lot of people. Meditation is a good thing. It's a bit difficult to learn meditation if you're in an overthinking spiral. So sometimes just watching a comedy, watching a light-hearted show helps distract you. And since you can't focus on two things at one time, it prevents the overthinking spiral from happening. There's a lot of comparison nowadays. This is, after all, mental health in an unequal world. So you will be compared to other people. Other people will have better access and better opportunities. And that can make you feel very upset. And that can make you feel things are unfair. But one thing which you can do is make a list of things that you are grateful for. And hopefully that helps you compare yourself less to others. What else you can do to look after yourself? What else can you do to self-soothe? Again, this is called grounding technique. Work on the 5 senses that you have. There's touch soft things, cuddle something, have a hot shower or cold shower, cuddle up in a nice blanket. Sight, look at the sky, see some soothing colors. coloring helps. There used to be a craze where adult coloring books would be around. That also does help. It helps with the focus, it helps with the color. Smell does help a lot. Aromatherapy, we can go out now, so please go out and enjoy the fresh air before all the cars come out again and then we get our usual haze. Candles, incense, again, be careful with this one. Sometimes a particular scent might trigger an unpleasant memory or might trigger, something traumatic. So experiment gently to see what works. Sound also works. If you go on YouTube, there are many ASMR videos. Go on Spotify, there's many nature sounds. Guided meditations are all over the place. Binaural beats are also all over the place. Just need to search, just need to see which suits you and matches you. And you are slowly learning to take care of yourself. Taste, we are not talking about binge eating, but eating slowly, eating mindfully, strong flavors, warm drinks, eating what we used to eat as a child, bringing back nostalgia. A lot of our old favorites from before are all making a comeback now because they are capitalizing on our nostalgia. Mindfulness is just one slide. It's actually a 3-day course. Okay, so being mindful is easier said than done. So simple things that we can do to be more mindful, be more present. Being mindful, being more present means we are not thinking about the past. We are not worrying about the future. Breathing is important. Focusing on your breathing by taking slow breaths, breathing in for a set number of time, beats, holding your breath for a set number of beats and letting it out slowly. That helps. Mindfulness means being in the present. So you can find any object. The common one which they used previously was a resin or any object you want, and pay very close attention to the details. So yeah, that helps because it helps focus your mind on the present. Pay attention to where we are sitting and focusing on the sounds and naming the sounds which are all around us. All these are things that can help us be more mindful. So this is done by Laman Minda. I think this was a collaboration between Dr. Melissa and Dr. Nurul from Kulim, if I'm not mistaken. So they were talking about self-compassion. They were talking about swacinta, and yes, it's really important. So in Malay, basically, perasaan bila diri sudah tidak okay. This is hard sometimes. We don't know when we are not okay. We still think that, we are all fine. Menerima keadaan diri, which means we accept ourselves for who we are. Melayan diri dengan baik. Memberi ruang untuk kesilapan dan kelemahan. Kurangkan self-judgment. Kurangkan kritikan diri yang tidak membina. Berupaya memujuk diri, self-comfort. So this is what I'm trying to teach you in this last 45 minutes or so. How do we take care of ourselves? Because, if we don't take care of ourselves, people may not be around to take care of us. Melakukan sesuatu untuk menambah baik situasi dan diri. What can we do to improve our situation? And like the same recurring theme, it's okay not to be okay. Ada hari yang elok dan ada hari yang tidak elok. Dan saya berasa tidak okay kerana sesuatu telah berlaku. If we have lost a loved one, we should be feeling sad. We should be grieving. We should be upset. We should be okay to say that we are not okay. And kita perlu ruang dan masa untuk okay semula. We need time. We need space. Referring to psychiatry, someone whose loved one has just passed away 2 minutes ago is not giving them the room and the space to process their grief. It is actually torturing them and it's actually making them feel worse actually. A note to all those who are not in the mental health field, who like to do that. Okay, so take things one step at a time and acknowledge to yourself that you are good enough. Okay, perjalanan hidup semua orang adalah berbeza kerana latar latar belakang masing-masing pun berbeza. Just like Dr. Anita's video, everyone starts differently, everyone has different issues, everyone starts off with a different transgenerational trauma. Benda ini memang susah. Saya tak tahu macam mana nak buat. Sebenarnya saya hanya belum jumpa cara yang sesuai. When we're overwhelmed, we will just say it's just too much, it's impossible, the workload will never end, it will never stop. When in reality, we just haven't found the right way to manage it. And we have to accept our limitations. Ada benda yang saya pandai buat dan ada benda yang saya tak pandai buat. So if we accept our limitations, then we can use our strengths and then we can feel more fulfilled rather than trying to force ourselves to be something that we are not. So which brings us to the second last point, fokus juga kepada apa yang saya boleh buat dan bukan sahaja kepada apa yang saya tidak boleh buat. Focus on your circle of control. And this maybe is the more important one, beri masa dan ruang kepada diri sendiri. Give yourself time, give yourself space. You are not Superman, you are not Superwoman, you need time sometimes. I'm not the only one. So hopefully if you go to all the better websites or the better Instagrams or the better Facebook pages, you will realize that a lot of people are suffering from the same issues that you are. And also, semua orang tak sempurna dan semua orang boleh terbuat silap. Dan bukan saya seorang sahaja yang mengalami keadaan ini. Dan semua orang ada waktu jatuh bangun dia. Everyone has their ups and downs. No one is all the way up all the time. That would be more meaning. And no one is down all the time. And we can see what we can do to improve the moment. So apa yang perlu kita lakukan untuk menambah baikkan keadaan saya sekarang? Macam mana saya boleh tenangkan diri sendiri? How do I self-calm? How do I self-soothe? Whether it's by eating, whether it's by listening to your favorite music, whether it's talking to your favorite friend, getting a hug from your child. Macam mana nak selesaikan keadaan ini? When you're overwhelmed, it's very difficult to see. But once you calm down, maybe new ideas can come out from your subconscious. And of course, adakah saya perlu bantuan? Do I need help? A lot of times we have a lot of ego, we want to be a one-man show, we want to do everything all by ourselves, but in reality, we need help, we need support. We cannot live as an island alone. We should also appreciate ourselves. We appreciate what other people do, but we somehow manage to forget our own achievements. So I did good today. Hargai setiap usaha dan kejayaan walaupun nampak kecil, kerana hanya kita tahu betapa kita telah mencapainya. Only you know how difficult it was to wake up, to get out of bed. Only you know how difficult it was to drag yourself to work with all the problems that you're facing. So you have to acknowledge that you did good just by being there, just by doing what you were supposed to do. And of course, set boundaries, please. Don't keep saying yes to everyone and then have a completely packed schedule with meetings every half an hour and with deadlines pouring down your neck. Because semua orang ada hak dan keupayaan masing-masing dan semua ada kepercayaan dan prinsip masing-masing. So everyone also has different beliefs, everyone also has different principles, everyone also has different values. And it's okay to say no to someone who has different beliefs and different values that you do, because the more you work with them, the more you end up clashing with them and the more toxic the environment gets, and that doesn't help anyone actually. So again, more from the Instagram sketches in stillness, self-love and acceptance reminders. You deserve to be here as much as the trees, as much as the stars, as much as the moon. And you're worthy now. Not if, not when. We are all worthy of love and your longing right now, right this minute as is. And you are valuable, not because you exist, not because of what you do, not because of who you help, not because of what you've done, but simply because you are. And remember that when you were born, you were called a miracle, and you still need to remember that you are a miracle now. and your value is your own. Your value does not decrease based on someone's inability to see your worth. We're running out of time. So the next time you feel anxious, these are some quick tips for you. Breathe. So a simple thing to remember is breathe in for 4 seconds and then out for 8. Do it 6 times. Slow breathing tells your brain that you are safe. Find something that makes you laugh. It will help distract you. And once distracted, hopefully that derails the anxious spiral. Put on some calm music. A soothing atmosphere can work wonders. Eat well. Eat colorful meals. Proper nutrition does help your mind keep healthy. I'm not sure whether I believe in cutting back on caffeine, but 1 cup of coffee does help wake you up. A lot of times we are very dehydrated. Phone a friend. Keep in contact, keep in touch with people. Sing out loud. That's what they ask us to do. There is science behind it. Trust them and write down what you're thinking. The more you write down what you're thinking, the more you can start to see the patterns of your thoughts, the patterns of what you write. Challenging intrusive thoughts, that's a part of cognitive behavior therapy. A lot of times we have a lot of automatic negative thoughts. When you feel more stable, when you feel in a secure place, challenge them. Is this true? What is the evidence that this is true? Why should I just believe it? Distraction helps. Scrolling through social media may not be a good distraction, but routines like washing up, doing the laundry, cleaning, that does help. When you're anxious, you're very keyed up, you have a lot of energy, so get some physical exercise, put the adrenaline to good use. Progressive muscle relaxation, that is in our website somewhere. We'll give you the link at the end of this talk. Go out to see some nature. 20 minutes is a good time to soak it all in. Boundaries for media. Yes, don't keep on scrolling. Set limits. Filter the feeds to what is positive. There's a whole lot of misinformation out there, so please just read stories from trusted sources. Don't read the news just before bedtime. It just gets you more angry and upset. And try to turn off notifications and do not disturb so that you can avoid reading unnecessary comments. For those who work, this is a good going home checklist. Take a moment to think about today. Acknowledge that the one thing that was difficult during your working day, let it go. Consider 3 things that went well. Check in on your colleagues. Are they okay? Check in on yourself. Are you okay? If you're not, look for someone senior to help you, and then focus your attention back to home. So this is Buddy Bear. Dr. Anita, our child and adolescent psychiatrist, is quite involved in this. So this is specifically tailored to children and adolescents. So if you have any children and adolescents that need help, you can share this with them, and they have a Facebook and an Instagram, so you can go there as well. Most of the things which I have spoken about, they are all in these links and resources. Laman Minda is a fantastic place to be. Kita Teguh Bersama is our government psychiatry KKM group where we share what we do to help the frontliners. iLife Suicide Prevention has many resources and a lot of training to help teach us what to do. And our Malaysian Mental Health Association has been there providing support for a very long time. Okay, so yes, continuing the same theme, be kind to yourself. Be to yourself the kindest, most loving, gentle, unjudging friend that you've ever known. Be to yourself the love of your life. And at the end of the day, just tell yourself gently, I love you. You did the best you could today. And even if you didn't accomplish all that you had planned, I love you anyway, because you need to learn how to love yourself. So I'll end my talk by playing a song. Hopefully it doesn't get taken down. That kind of does resonate quite a lot with me. It's been just made into a movie, so if you have the chance, please go and catch it when it comes out.
Have you ever felt like nobody was there? Have you ever felt forgotten in the middle of nowhere? Have you ever felt like you could disappear? Like you could fall and no one would hear? Well, let that lonely feeling wash away. Maybe there's a reason to believe you'll be okay. 'Cause when you don't feel strong enough to stand, you can reach out your hand. And oh, someone will come running, and I know they'll take you home. Even when the dark comes crashing through, when you need a friend to carry you, and when you're broken on the ground, you will be found. So let the sun come streaming in, 'cause you'll reach up and you'll rise again. Lift your head and look around. You will be found. You will be found. You will be found. You will be found. You will be found.
Have you seen this?
People started sharing it, and now, it's everywhere.
This morning it only had like 30 views.
Well, how many does it have now?
720.
2,326 views.
14,359.
I don't understand what happened.
You did.
There's a place where we don't have to feel alone.
Oh my god.
Everybody needs to see this.
And every time that you call out,
you're a little less alone.
I can't stop watching this video.
17 years ago.
If you only saw.
Giving us a space to remember Conan. Thank you, Evan Hansen.
Tampa.
Sacramento, Michigan. Thank you.
be found.
Okay, so with that, thank you and happy World Mental Health Day. And that's all for me. Thank you very much.
Thank you, Dr. Kevin. Thank you for the delightful delightful presentation. Hopefully, all of you will practice self-care tips shared by Dr. Kevin to help us stay insane and mentally healthy. If you can practice all, please practice some. All right. Okay. So now we are finally at the end or the last part of our webinar. So I would like to invite Dr. Ramli bin Muhammad Ali as Head of Psychiatry and Mental Health Department to deliver closing remarks. Dr. Ramli.
Thank you, Nurul. Thank you, Puan Najwa. Okay. So I think here I think it just left for me to thanks all the speakers. To thanks again Dr. Nadia for the wonderful opening officiating remarks. To our Dr. Hajah Salina, our Head of Service in Psychiatry, for the wonderful a lot of informations about the current issues, the tips, and then the wise advices that been given to us through her speech. And also from our own department, Dr. Anita and Dr. Kevin. Oh, it was wonderful to me. Thank you again. And also to Miss Chan Fei Ha. From HKL, I think she was with us, I think some time ago. Now she was nearby. And she told us about the evolution of PFA and the way to go that we need to look into that as well. Thank you, Ms. Chan Peha. So I also need to thank all of you to stay put until the end of the program. So this is, I think, a very excellent kind of a number of participants that keep staying for until the last sort of closing remarks. And also, I would like to thank our wonderful chairperson, Puan Nurul Najwa, our clinical psychologist, and also people at the backstage, Miss Kylie, our clinical psychologist as well, and the rest of the team member of the Jawatan Kuasa Sambutan Majlis Sambutan Hari Kesehatan Sedunia 2021. So with that, thank you very much. See you again next year for our next World Mental Health Day celebration for 2022 next year. So all the best. Assalamualaikum warahmatullahi wabarakatuh. Bye-bye. Back to you, Puan Nurul Najwa.
Waalaikumsalam warahmatullahi wabarakatuh. Terima kasih Dr. Ramli. So now we can see attendance form on the screen. So for those who did not register yet, please do the QR code scan for your attendance. Okay, so we have come to the end of this webinar. Thank you to all of our speakers and thank you everyone for joining us. We hope each of you benefited from this webinar. I would like to end the webinar with dua rangkap pantun. Banyak keluk ke penarik, keluk tumbuh pohon kuini. Nan elok bawa lah balik, nan tak elok tinggallah di sini. So, only one rangkap. Okay, so with that, thank you for joining us today and we'll see you next time. Assalamualaikum and bye-bye.